um, while board staff works with her to join.
This meeting is being recorded.
Good morning, everyone. Welcome to day 2 of the Board of Registered Nursing second day board meeting. It is November 16th, 2023, and we will take roll call to establish a quorum. My name is Dolores Trujillo. Currently, I am a practicing RN and I was appointed by Governor Newsom to represent the direct care provider role, and I am the current president of the board. Vice President Mary Fagan.
Good morning, everyone. I'm Mary Fagan, Board Vice President. I was appointed by Governor Newsom in the Nursing Services Administration role and am currently a nurse executive.
Thank you, Mary. Board Member Jovita Dominguez.
Jovita Dominguez, Chair of the Education and appointed by Governor Newsom.
Thank you. Board Member Patricia Nguyen.
Hi, everyone. I'm Tricia Nguyen. I was appointed by Governor Newsom in the public member role, and I'm the chair of the Enforcement Committee.
Thank you, Tricia. Board Member David Lawler.
Good morning. I am David Lawler, appointed by Governor Newsom in a public member role.
Thank you. Is Vicky on?
No, ma'am, she is not.
Okay.
However, she did just contact me and let me know that she can't get in. So I am working with her at this time.
All right. Thank you, Lori. Board Member Allison Cormack.
Good morning. My name is Allison Cormack. I'm a public member appointed by the prior Speaker of the Assembly.
Thank you, Allison. And Board Member Neelu Patel.
Is Neelu Patel, and I was just recently appointed by Governor Newsom for the advanced practice role. I am a certified registered nurse anesthetist, and I'm a faculty educator from Southern California.
Thank you, Neelu. All right. So prior to us opening for public comment on agenda item 8.7, I believe, Lori, you have something to say?
Correct. We'll just do a quick recap. Sorry about that. From yesterday, and just kind of set the stage so that we know what we're doing here. So we are going into agenda items 8.7. It is a continuation from yesterday. It is to consider, it is for our board to consider a excuse me, Vicky just messaged and said she is in and just needs elevated. Yep, she is in. Board moderator, if you can elevate her, thank you. Okay, so it is in front of the board to consider an enrollment increase request. In 2013, their last approval for an enrollment increase was 100 students 5 times a year at each one of their campuses. That is a total enrollment of 1,500 students per their program, enrolled on an annual basis. To redirect to Business and Professions Code 2786.2. What is up for discussion is the enrollment increase, and the board can only consider adequacy of clinical resources, including but not limited to faculty, facilities, equipment, and supplies, availability of clinical placements, complaints that have been verified by the board from students, faculty, and other interested parties, licensing examination pass rates, graduation rates, and retention rates, and any other similar factors specified by the board and regulations. And the board shall not consider nursing workforce issues, including those identified under section 2717 as factors for the purpose of this subparagraph. What we also need to take into consideration is that there was a lot of emotion yesterday on the meetings. There was some history that was talked about, went back and forth. I understand that set the stage, but what we do need to make sure that when we are considering this enrollment increase, that the board stick to the statute, and what was put forth in front of us is what we can consider when looking at whether granting, altering, or denying an enrollment increase that is in front of our board. There was a lot of conversation yesterday about the quality of West Coast University, what would happen with the students, what would happen with faculty. And we hope that we were able to address that and put a lot of people at ease. We did make a mention that the students that are currently enrolled, this board's enrollment decision, whether it be to grant full approval or to alter it in any way, that the school is required to teach those students out. They will not be disenrolled. They will not lose their placements in school pertinent to this board decision. This board's decision is enrollment increase moving forward. And the board will also set a timeline for West Coast University to come into compliance. Therefore, if the board does state that an enrollment number is less than what the West Coast has requested, what will be stated is they would have 6 months, 1 year to come into compliance. That would mean that until that timeline is completed, West Coast could continue to enroll a number higher than what the board set forth in this. Allison yesterday gave amazing factual information. She brought forth some metrics. She had her own table. I commend you very much for doing that. I appreciate that. I am a person of numbers, and so I wanted to definitely share that. If there are different questions that come forward where you guys need more numbers, I have them available today, and we can move forward with that. With that said, we will go into public comment as promised. We will hear from public commenters on the call. They are limited to 2 minutes per each public comment. Then when we come back, I will then do another redirect to ensure that even though there may be quite a lot of emotion in the public comments, that the board consider only the factors that are allowed in statute for us to consider. Thank you guys for your patience, and welcome to day 2 of our board meeting. Board moderator, item 8.7 is open for public comment.
Thank you, Lori.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. Oops, sorry. I've activated the question and answer feature. Members of the public can indicate if they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Okay, sorry.
I just want to step in real quick as our board moderator is doing this. Yesterday, we had 2 people moderating the board meeting for us. Because we did go into day 2, we have 1 person moderating the board. So if you guys can be patient as he juggles 2 roles today, that would be great. Thank you.
Okay, so I see at, let's see. Okay, so do I need to, before I start open Q&A, Scott Casanova asked if it was possible for the 3 individuals to be elevated. Is that okay?
Yeah, you can absolutely elevate them, but we will go right into public comment.
Okay, sorry, now I have to find them. Scott, Catherine, and Shuriana.
Mark,
yes.
Apart from being elevated, were they requesting to make any very brief introductory comments?
It just says, they're just asking, is it possible?
Absolutely, yeah. Go ahead and elevate them.
Okay, sorry, real quick here, and then I will get to the... Okay, they've been elevated. Okay, Brendan Repecki would like to make a comment. 1 second, please. Brendan, go ahead. Brendan, are you there? Brendan, we cannot hear you. I cannot get, Brendan, I'll have to come back to you, sorry. Eileen Ricker would like to make a comment. 1 second, please. There you go. Sorry. Yes, you're fine. Thank you.
Great. Good morning, everybody. I'm Eileen Ricker. I'm the Chief of Staff for Senator Scott Wilk. I'm here on his behalf. He was unable to be here this morning. Senator Wilk represents the 21st Senate District, which is parts of northern Los Angeles County and the high desert area of Victor Valley and San Bernardino County. He also serves on the Senate Business Professions Committee, and they oversee nursing policies and the Nurses Practicing Act. This role's allowed him to have a deeper understanding of the challenges of nursing education and the nursing workforce. On a district level, he constantly hears from constituents who are frustrated because they can't get into nursing schools or they can't find educational opportunities or slots to go into nursing to pursue those careers. And on the flip of that, he hears from the hospitals in his district and other healthcare things that they aren't able to fill the empty slots they have because there is a lack of workforce. So what we hear, the legislature is obviously very concerned about this, going to maintain discussions, is having discussions on it. But as legislators, we hear from both sides of that issue. So it seems to me, in listening, and I listened all day yesterday, that students want more schools, more slots, and employers want more nurses. And that's kind of the fundamental question that you're being asked today, is to allow for more growth in an industry that there's demand for it and people want to be actually in the programs. So the thing that would not help this situation would be to reduce those opportunities. So I guess from Senator Wilk's perspective, he's asking you to please not hurt future students and hinder kind of an already really precarious healthcare workforce with this. And he's urging you to support their petition for the increased enrollment. Thank you.
Thank you for your comment. I'm going to try and go back to Brendan Rickey again, real quick here. Let's see. Oh, I'm sorry, Brendan Ripecki. Go ahead, Brendan.
Thank you. You can hear me?
There you go. Thank you.
Apologies for earlier. Morning, folks. My name is Brendan Ripicki. I'm Assemblymember Cotty Petrie Norris's Legislative Director. She represents the 73rd Assembly District, which includes Irvine, Tustin, and Costa Mesa. Assemblymember Petrie Norris is very familiar with West Coast University and the nurses.
Uh-oh. Brendan, we lost you. Okay, we will wait for Brendan to come back. I am going to go to Jamie Reyes. 1 second, please.
Am I coming through clear?
Yes, sir.
Yes,
you are.
My name is Jamie Reyes, and I'm here today to share with you how important it is for underrepresented students to have access to an excellent nursing education. I'm urging you to support this application. My twin brother and I both came to West Coast University, Los Angeles after sitting on wait lists. We're actually about to celebrate our 10-year anniversary from graduating with our BSNs. And after graduation, I worked bedside in med-surg and orthopedics, felt a call to education, and I'm now the manager of the Sim Lab in North Hollywood. which has been fully accredited by the Society of Simulation in Healthcare. We're a proud family of immigrants. We grew up in a multi-generational family, lived in a one-bedroom apartment with 6 people. So our culture is to work hard, take advantage of every opportunity. So we chose West Coast because we could no longer put our lives on hold sitting on a wait list. And we were definitely impressed with the school's mission to be student-centric and be proud of its outcomes. And I believe West Coast lives up to its promise to put students first and empower the faculty. West Coast has provided my brother and I not only the opportunity to become bedside nurses, but encouraged us to become educators and assisted us to achieve advanced degrees. We got our master's with West Coast University as well. If we hadn't had this access, more likely we would have been stuck on a wait list and wouldn't be on healthcare now. So we aren't unique though. Our future and current students are coming to us with the same backgrounds, and I believe they are just as deserving. So please approve this application. Thank you.
Thank you for your comment. Assemblyman Heath Flora would like to make a comment. 1 second, please.
District, which is Central Valley, Stanislaus County, all the way up into Sacramento County. And I am calling in just strong support of the petition in front of us by West Coast University. The state for many, many years has been trying very hard to figure out how to get low-income, underserved individuals into colleges and get them an education so they can get their lives and their careers on the path. West Coast University is absolutely a partner in that endeavor. So denying this application would fly directly in the face of everything the state has been working very, very hard to do. So I strongly encourage the support of this, and I'm thankful that there are folks out there like West Coast University that are willing to do this and have stepped up. Thank you.
Thank you for your comment. I'm going to go back to Brendan. 1 second, please. Oh, sorry. Now Brendan fell off. West Coast University, Ontario would like to make a comment. 1 second, please.
My name is Vivian, and I am currently an LVN case manager and a student at West Coast University in Ontario. I'm asking the board today to please approve this application for West Coast University in Ontario, because for me, I am an immigrant and I came to the United States wanting to make better decisions for myself and my family. And the reason why I chose West Coast University is I'm currently a mom to 2 children. I have a 4-year-old and a newborn. And West Coast has given me the opportunity for me to be able to attend school and have better opportunities for myself and my kids. And another reason why I chose West Coast University is because I was on a wait list at Riverside Community College, which I love, for years. And I decided to try West Coast to continue my education. And fortunately for me, I was able to be one of these students that was accepted into the LVN to BSN program. And I feel like West Coast is also giving me the opportunity to be a better nurse, because I've had situations in my workplace that I used knowledge that I acquired from school here to be able to help my patients. I want to be able to do more. So I'm asking that the board consider the application for West Coast University and approve it so other students like me can have the same opportunity. Thank you.
Thank you for your comment. Mona Clayton would like to make a comment. 1 second, please. Mona, go ahead.
Good morning. Thank you for your time. I am a registered nurse with over 20 years experience and CEO and founder of the nonprofit organization, the Nurses Pub, which was established in 2018 with the goal to recruit 100,000 future nurses into the nursing community. Our focus is on the underserved community, and students out there are extremely thirsty for enrollment, in which we are a mentoring and a recruitment station. I have three ways in which I know that there is a need to open up this platform for more students. One, firsthand as an experience with the challenges that the nursing students are facing, as I have worked as a travel nurse with West Coast University students, and they are definitely producing stellar quality students. Again, as a CEO and as a mentor, I have worked with students who are attempting to enroll in schools and are having extreme challenges in getting into nursing programs, and as an educator. I did listen to Miss, I think her name is Piazza yesterday, and I second the motion of everything that she said is extremely true. I've experienced that in all aspects of what we're doing at the Nurses Pub, and that's P as in Paul, UB, nursespub.org, thenursespub.org, and I approve what they are attempting to do in terms of enrollment. Thank you for your time.
Thank you for your comment. Griffin Beauvais, Office of Assemblywoman Kate Sanchez would like to make a comment. 1 second, please.
Hello?
Go ahead.
Oh, great. Hi, board members. This is Griffin Beauvais on behalf of Assemblywoman Kate Sanchez, who represents portions of Southern Orange County. The Assemblywoman believes that WCU has outstanding outcomes for students and that its growth should not be limited. The school has about 600 students on its wait list, and hospitals in her area are deeply impacted by the nursing shortage and need to hire nurses to meet their nurse-to-patient ratios. A rollback in enrollment will only make this shortage worse, and she's very concerned about that. So on behalf of Assemblywoman Kate Sanchez, I respectfully request your support for WCU's enrollment application, and thank you for your consideration.
Thank you for your comment. Brendan, we're going to try you again. 1 second, please.
Can you folks hear me?
There you go.
Okay, thank you.
Welcome
Apologies
back.
for my microphone issues. My name is Brendan Rupicki. I'm Assemblymember Cotty Petrie Norris's Legislative Director. She represents the 73rd Assembly District, which includes Irvine. As some other folks here have noted, she's very familiar with West Coast University and the good nurses that they produce, and just wanted to issue a statement of support that she supports their enrollment requests and respectfully ask that you take steps to also increase their enrollment. Thank you very much.
Thank you for your comment. Trisha Kassab would like to make a comment. 1 second, please. Yes, go ahead, please.
Oh, very good. Thank you. Hi, my name is Trisha Kassab, and I'm a registered nurse. I have been a healthcare executive for over 25 years. I transitioned earlier this year to academia to help mentor the next generation of healthcare professionals. Just a few points to make. California is experiencing an extreme shortage of nurses. You know, and I saw it every day in the hospitals that I've worked at. The U.S. Department of Health and Human Services estimates that California needs an additional 50,000 nurses today. And that in the state, that's expected to go up to about 193,000 by 2030. The California Health and Human Services agencies deem the counties of LA, Orange, and Inland Empire, where West Coast University has campuses, as having a shortage of registered nurses. And last year, the state of California spent $2 billion to pay traveling nurses to help alleviate the nursing shortage in the state. And as many speakers previously have said, it's well documented that the nursing shortage disproportionately affects the quality of healthcare, particularly in the rural and low-income areas, communities of color. And this is where a lot of our West Coast University graduates serve, with 70% of the West Coast students claiming minority status. So we can't be hindering nurses' education. Thousands of nursing applicants are turned away every year. And I will tell you, one of the reasons that I've chosen to go to West Coast is because, and I think Ms. Piazza said it yesterday, the amazing technology that's offered our students, the simulations center in itself, the high fidelity mannequins are truly amazing. So I would ask the board to please approve this application. So thank you for that. Thank you.
Thank you for your comment. George Boutros would like to make a comment. 1 second, please. Go ahead, George.
Thank you so much. Hello, my name is George Boutros, and I'm with the Orange County Business Council. Orange County Business Council, the leading advocate for Orange County economic vitality, stands firmly in support of initiatives that drive economic growth and enhance the quality of life for our community. And OCBC requests to support this application. The imbalance between supply and demand in the nursing field was an issue before the pandemic, driven by factors such as nurses reaching retirement age and limited nursing education availability in the state. The disruption caused by the pandemic has significantly increased the average hospital vacancy rate for nurses, reaching above 30%. This places California in a critical situation regarding this matter. Despite a substantial investment of $988.4 million in the 2023-24 Budget Act to address shortage in care, the Board of Registered Nurses should not reduce enrollment. Fewer Californians are being allowed to become nurses not only poses a risk to patient care, but also has economic implications. Registered nurses in California are the highest paid in the nation, with an average annual salary of $133,000. Excuse me. The central plea is for the board to maintain or increase enrollment levels in BSN programs, aligning with legislative recommendations and the significant demand for qualified nurses in the current market. Artificially reducing enrollment numbers at a time of heightened demand for qualified nurses is deemed harmful to healthcare providers, the economy, the overall healthcare provision throughout California. Thank you for your time and your consideration in this matter.
Thank you for your comment. Nam Hien would like to make a comment. 1 second, please. Hello, go ahead.
Good morning, committee members. My name is Nam Tien, and I'm a student at West Coast University, Anaheim, and the former president of our Student Nurse Association. Today, I'm asking for your support for West Coast University's application. I was raised in Long Beach, where many of my colleagues also seeking a nursing education are now becoming waitlisted, turned away. I believe West Coast University provides this opportunity for students like myself who wanted a head start. West Coast has, now that I am a couple of months away from graduating, I believe West Coast has provided me the necessary experience as well as skills to successfully start my career and build a strong career. It has also led me to want to pursue my graduate education in order to teach. And I hope that you please support this application so that more students can fulfill the same purpose. Thank you.
Thank you for your comment. Julius Bernardo from West Coast University LA campus would like to make a comment. 1 second, please.
I'm a current student at the North Hollywood campus and set to graduate spring of 2024. I ask that you support this application to allow future students opportunities that I have had. I began my career as a sheriff's deputy where I patrolled and led training programs. After a few years, I decided I was ready for a change and to follow my mom's path into nursing. I became an LVN and worked in the clinic in units such as cardiology, plastics, urology, internal medicine, and I currently work in a step-down liver transplant unit. I also preceptor and help teach future RN students, and this combined with my experience in public safety training made me realize that a goal of after graduation is to teach as I continue my academic and professional career. I speak Tagalog fluently and conversational Spanish, which I use both these languages daily to assist patients, especially with pain management. I chose West Coast University after doing my prerequisites at a community college and sitting in a wait list without gaining entrance to a public program. I knew I might never make it off a wait list. No matter how experienced and qualified I was, I chose West Coast University because of the outcomes, accelerated program, and clear objectives of the school. My dream career is to become a critical care transport RN. Please approve this application so future students, especially those who are non-traditional students of diverse backgrounds, can have the same opportunities that I have had. Thank you very much.
Thank you for your comment. Cami Bathke, College of the Canyons, would like to make a comment. 1 second, please.
A California community college, and I live 4 miles away from Los Angeles Southwest College, where I have also worked part-time in their nursing program in the last couple of years. The program has lost clinical sites to private nursing schools. I am speaking up against growth for West Coast University because of the vast cost of this private school. I'd like to ask the BRN to continue to advocate for faster growth in college programs that provide quality education at a very affordable price to the community. Community colleges offer financial
Key? I don't know if you can hear me. You're coming through a little bit garbled. I want to make sure that we can hear your comment. I assume I'm not the only one that was having difficulty hearing it. Maybe try.
I'll try something else. Yeah, I was holding.
The gist of what I had heard so far was that your program, College of the Canyons, has lost clinical sites due to West Coast. Is that?
That's not what she said.
We're still. I'm trying to hear what she said. I'm asking her to confirm, Scott. So thank you.
Yeah, she will have to come back to her. She'll have to find another way to connect. Zena Relente from West Coast University's LA campus would like to make a comment. 1 second, please.
My name is Zena Relente. I am president of North Hollywood Campus Student Nursing Association and a senior coordinator of our peer tutoring program. I was an engineering student when COVID hit and I was hospitalized. It was a terrifying experience, but the comfort and compassion I received from the nurses inspired me to take this path. I changed majors and attended 2 different community colleges because even their prerequisites classes had wait lists. So I knew it might be impossible to even get into the core programs. I had several friends who attended West Coast University and they encouraged me to apply, and I'm so happy I did. My clinical placements and instructors are great. The instructors pushed me to work past my doubts and tackle more challenging cases. I've been able to use my ability to speak Tagalog and Bisaya with patients, and I see the difference it makes. During my psychiatric health rotation, I provided a patient that needed that bit of familiarity of language and cultural competency to be comfortable enough to accept care. Please approve this application so future students can also have the opportunity to become nurses and make a difference to diverse communities. Thank you.
Thank you for your comment. West Coast University, Ontario has another comment. I don't have a name though, so 1 second, please.
Hi, good morning. My name is Daniel Contreras. I'm currently enrolled at West Coast University's Ontario campus. Before I came to this school, I was in the military, served 8.5 years in the Navy, did 2 back-to-back deployments. And I respectfully ask you guys to support this application so that more non-traditional students like myself have access to a nursing program. Being a veteran has allowed me to provide better care for senior patients that are also veterans and are often too proud to share concerns or their pain with their providers because they don't want to seem as if they're complaining or weak. Knowing they can trust me has helped me improve their lives tremendously. My call to nursing came out of a lifelong desire to be a community helper, and that's one of the main reasons why I joined the military. Academics have never come easy for me, and after high school, I joined the military to try to avoid schooling and careers, but I soon learned that a higher education is necessary for advancement for whatever path you choose. My family always encouraged me to follow my dreams, and one big piece of advice my brother gave me was, the hardest part is starting. So I took his advice and began my prerequisites at Pasadena Community College in 2020. Unfortunately, while talking to a counselor, they said I wouldn't be able to look into a nursing program until 2023, and that's even if I was eligible at that time. But here I am at West Coast, scheduled to graduate next year, June. West Coast has a great option for me, and I encourage you guys to improve this. West Coast program is academically hard, but my teachers and counselors have worked to help me learn, study, organize, and time management skills that I need to be successful. I aim to work in ICU and overall be a flight nurse. And as a veteran, I know I can handle the tough situations those paths will put in for me, and I can deliver excellent patient care. So please support this. Thank you.
Thank you for your comment. Dr. Levi Harrison would like to make a comment. 1 second, please. Go ahead, Dr. Harrison.
Dr. Harrison, I'm supporting West Coast University's application to expand. I like to, as a practicing orthopedic surgeon here in Los Angeles, it's so imperative that we increase the number of practicing nurses in California specifically. During the pandemic, it was quite clear that there was a shortage of nurses, of course, and there was an increase in traveling nurses. And we know, of course, that the state of California spent over $2 billion to pay traveling nurses to alleviate the nursing shortage in the state of California. And it's really well documented now that we need more nurses. There are thousands of qualified nursing applicants that are turned away from programs every year. Even the BRN, the BRN reports there are 55,000 qualified applicants were turned away just last year. So I think it's so imperative that the BRN, the mission statement, claims that it will promote quality registered nursing in the state of California. And given that West Coast University has graduates successfully completing the program on time, doing great on their NCLEX, and earning an average of more than $100,000 per year, this board should be doing everything it can to increase West Coast University enrollment and not to hinder it. So I am in complete support of West Coast University, and I'm truly asking with humble humility that the BRN will increase and accept the number of nurses that are needed here in California via West Coast University. I'm asking that you accept their application, that you increase the number of nurses through West Coast. And I know that with good faith and good hearts that all of you have, that you will do the right thing. This is my mission, and this is what I ask of you. Thank you very much.
Thank you for your comment. Al Bonds would like to make a comment. 1 second, please.
Hello, can you guys hear me?
Yes, sir. Go ahead.
Good morning, ladies and gentlemen. My name is Al Bonds. I am a project director for the California Association of African American Superintendents and Administrators. I'm here to speak in support of West Coast University today. West Coast has been an advocate for our local communities. Their students have volunteered at our community health and wellness events and have helped with our underserved and low economic communities here in Los Angeles. West Coast has been a strong supporter in our efforts, along with many other organizations within the greater Los Angeles area, with a focus truly on helping those in underserved communities. The reason why I'm calling in today and speaking today is not just because they support organizations like ours, but their program truly creates access to education and meaningful careers for students from all backgrounds. West Coast gives students a choice and an option, meaningful career in nursing, and we're truly in support of that. In a time where there's a large disparity in access and equity in healthcare, universities like West Coast, we strongly support and advocate for. Thank you for your time and your support, and please approve their application. Thank you.
Thank you for your comment. Ima would like to make a comment. 1 second, please. Ima? I'll come back to Ima. Tammy Bathke would like to make a comment. 1 second, please.
So, I am a nursing program manager at College of Kansas, a California community college, and I also live 4 miles away from Los Angeles Southwest College, where I have also worked part-time in their program in the last couple of years. Their program has lost clinical sites to private nursing schools such as West Coast University. So I'm speaking up against growth for West Coast University because of the vast cost of this private school. I would like to ask the BRN to continue to advocate for and foster growth in community college programs that provide quality education at a very affordable price. Community colleges offer financial mobility through education to a diverse and lower socioeconomic segment of society that would otherwise not have the opportunity. Thank you.
Thank you for your comment. One second, please. I am waiting for direction. Okay, Ima, go ahead.
Thank you very much for giving me the opportunity. Hello, can you hear me?
Yes, we can. Thank you.
Please,
Ima?
No.
Board moderator, is this the same commenter from last night?
Yes.
So have we heard her public comment once? Or is this an additional?
I don't know. I was just informed that she commented yesterday.
Okay. Let's work to see if we can get her back on.
Ima, go ahead. Okay, let's see. One more time. Sorry. Ima, are you there? You're unmuted. If you're on your cell phone, it's *7. If you are on a computer, it should be right in the middle of your screen. Unmute. You keep going. You keep unmuting yourself or muting yourself.
hello.
There you are. Ima? Ima, are you there? One more time. Let's see. Ima, are you there? Ima, I will come back to you. Dr. Melanie Horn-Mahlers would like to make a comment. 1 second, please.
Good day, everybody. Oh,
Go ahead.
a good day. I just want to preface this with I'm just logging on now. So if I'm being redundant, my apologies. I was able to listen to a full session yesterday. And so I want to piggyback off a few things. I am a professor at a local CSU. I've been doing this for over 20 years, and I work in the health field. My research is related to health. We do have a nursing program at several of our CSU campuses, and I'm very well connected to students across disciplines. And it is a regular pattern that I hear that programs for your university's nonprofit are impacted, or students do not have the qualifications to get in. This obviously is a detriment when we're trying to close the equity gap. And one of the things that I believe in is if we have a strong for-profit healthcare institution that helps to level the playing field, that is a requirement in our society. Yesterday, someone was mentioning that there seems to be a pattern that for-profit, specifically West Coast, is sort of sabotaging or taking over the possibilities for students who come out of community colleges. And there was no evidence for that. That was anecdotal information, things that they hear from students. I have also, as I said, hear from students regularly over 20 years. And my information directly from them is that they can't, as I said, get to their nursing degree. They have to go to a for-profit. Now, this doesn't mean that all for-profits are doing a good job, but the data regarding, because I've researched it, NCLEX scores, the simulation labs that exist at West Coast as compared to simulation labs, as an example, at CSUs, there's no comparison. I am typically a nonprofit person. I came out of public school education. I've chosen after my doctorate to work for nonprofit institutions, Hispanic serving institutions. But when, again, you do your research and look at West Coast.
Thank you for your comment. Your allotted time is expired. Renee Schweitzer would like to make a comment. 1 second, please. Ms. Schweitzer, go ahead. Hello? Nope, I lost her. 1 second, hold on here. Ms. Schweitzer, are you there? I'm going to go back to Ima. Ima, go ahead. Ima. I will come back to you, Ima. Indiana McClellan would like to make a comment. 1 second, please. Go ahead.
Oh, yes. I just would like to make a comment about just being displaced at several facilities in the area, specifically by West Coast. And I know this specifically because of the area that I'm trained in. And I always say my students are currently being trained with a training West Coast student. Right now, the challenge is not that the displacement is part of it is not even sharing, is that they get what they call prioritized placement, and then they take all the units and then we have none. So and I can think of at least 2 hospitals right now where it's becoming a challenge. And thank God I have a team of folks that are helping us as ADN programs to get back in the facility. But it is a challenge because they continue to grow, and know that people are saying there is the priority placement, and I'm sure there's monetary attached to it because I've been told that. But the main thing is just want to be fair and get some equity for all students so that we all can address the nurse shortage issue and be fair. Thank you.
Thank you for your comment. Mai would like to make a comment. 1 second, please. M.I.
Hello.
Go ahead, Mai. Go ahead.
Hi, my name is Michael Lachance. I'm from Mount St. Mary's University, and I agree. There's been some wonderful things said today about the need to increase enrollments for school. However, I feel there's a bigger issue that's being missed here, and it's rules and process. And I believe as institutions, we set examples to the individuals who attend our schools. And I feel that the message here, if we were to approve this enrollment, is that it would be okay to break rules, and that this would set a precedent for other schools to engage in the same behavior. That's the end of my comment. Thank you.
Thank you for your comment. Renee Schweitzer would like to make a comment. 1 second, please. Renee, go ahead. I'm sorry, Renee. We are not getting anything from you. I'll come back to you or try a different connection. Martha B. Despodo would like to make a comment. 1 second, please. Martha. Yeah, I will try Ima again. 1 second. Ima, are you there? I'm sorry, Ima. I don't know why you cannot speak.
Is that somebody that we heard from yesterday?
Yes.
Okay. Well, fortunately, we had a chance to hear her comment, so I think we should move on.
Okay, I'm going to go back to Martha. Martha, 1 second, please. Martha, go ahead.
You're muted. You can't unmute yourself.
I can hear you just fine.
You can hear me now?
Yes, we can.
All right. It's a little trying to get through this system for me, so I apologize. I'm Martha Despodo. I'm the Chief Nurse Executive here at Kaiser Permanente, Orange County, Anaheim. And very appreciative of our West Coast University students that we get within our organization. I have taught at West Coast University years ago, very supportive of this team. And I'm not sure if there's anything else that anyone wants to ask me, but do appreciate all that they bring to our community.
Thank you for your comment. Judy Corliss would like to make a comment. 1 second, please.
Oh,
Go ahead.
can
Judy.
you?
Yes.
Hi, can you
Go
hear
ahead.
me?
Yes, ma'am. Go ahead.
Hi, this is Judy Corliss. I am a former board of registered nurse member. I worked under two governors, Governor Schwarzenegger and Governor Brown. And I have been quite instrumental in getting clinical sites for many schools. And during my tenure, we actually created the form, or helped create the form, that you cannot go to a clinical site and sign up a new school or a private school without a list of who all is there, each school, where they work, how many students are there, and we have to sign an affidavit that says you cannot displace any student. We did not have that when I joined the board in 2009. We do now. So every school that I have currently worked with, which has been 9, we have not displaced anyone. Now, I don't work directly for West Coast, but I'm saying all the private schools I've worked with, we sign those forms. We're not allowed to displace anyone. And those forms are continuing to be placed before every school and every clinical site that is obtained. And so that should be taken into consideration nowadays when you look at private schools that are able to fill the nursing shortage, in addition to the state schools that don't have the numbers or the money. So I really am for the schools continuing to add students till we can get this backlog filled and stop using, the registries. It's costing hospitals billions of dollars. Thank you so much for allowing me to speak today.
Thank you for your comment. I'm going to try Renee Schweitzer one more time. 1 second, please. Renee, are you there?
Mute yourself.
There you go. There you go.
Oh, God. Thank you. I have IT with me. Thank you for the third try. Hello, board members. My name is Renee Schweitzer, and I've been a nurse in California for 30 years. I've spent the last 15 of those years, half of my nursing career actually, on the team with West Coast University that has helped to build the clinical partner infrastructure for the university. I share this background with you today as it demonstrates an intimate understanding that I have of the process for clinical placements. And I appreciate the colleague that just spoke in front of me as well. I'd like to thank board member Allison Cormack for her desire to seek data to drive this board's decisions. When words like displacement or impacted region are used, they are unsubstantiated, board. There is not one documented example, site, date, time, or even one piece of data that supports that WCU has, does, or ever will displace other nursing programs. That is not what we do. One thing that has been left out of our discussion that's important is that every clinical placement is the sole decision of the clinical partner. They choose what programs they desire to partner with. If the board chooses to deny this enrollment request, that does not equate to opening more clinical spots for any other program. Again, I repeat, the clinical sites decide who to partner with. They sign a document that our colleague just spoke about that they created that specifically has site names, units, floors, days, times of each and every clinical placement. I quote directly, the signature below verifies that the use of this clinical facility by the requesting nursing program will not displace, in capital letters, students from other pre-licensure nursing programs. And the sites sign this. Clinical partners sign this. The board should not and cannot base their decision today on words. There is no proof of displacement or impaction. Thank you very much.
Thank you for your comment. RB would like to make a comment. 1 second, please.
I'm a West Coast University alumni, and I would like to speak in support of West Coast. I would also like to thank everyone who have all perspectives on this issue. Being an alumni who graduated from West Coast University in 2020, I have had many opportunities to learn some incredible things. Now, as a nurse, I have noticed some interesting I see the plight of a lot of the folks who are making the case against West Coast. However, I feel as though I'd like to express my feeling to the board that I feel as though the issue lies more with incentive to hospital. As a nurse now working in telemetry for 2.5 years, I have felt that the student nurses who show up, while they are a great asset, and I feel blessed to be able to help be a part of their training, it's a very overwhelming task as a nurse, and there's no real incentive as a working nurse or the rest of the team to help with the training of these individuals. So I feel as though, while I do think we definitely need to increase the intake of all schools, especially West Coast, as they are a phenomenal school and they have phenomenal outcomes for all students. I feel as though there could be some other incentives, like one example would be some kind of state tax reimbursement for a hospital, or some kind of incentive on a state level or a local level or city level or county level for hospitals to take students from surrounding local schools. Again, I am in support of expanding all of West Coast's ability to really improve the local communities that they serve. That's the end of my comment. Thank you so much.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments. Would you like me to close this window? Dolores, you're on mute.
Are there any other comments or questions from board members?
What West Coast does have some additional information we'd like to present before it goes to a vote.
I question the board at this time. I'll take that into consideration, Mr. Casanova.
And perhaps, so this is Board Member Neelu Patel. I have a question regarding clinical sites, and I haven't heard much discussion on what that's like when you increase the number of students, or with a pretty large increase in the number of students. How many clinical students are there per preceptor in the clinical sites? Can you speak to that?
I can speak to that. This is Kirina Piazza. Again, I'm the Dean College of Nursing. I'm also the program director. And while I thank you, Mr. Casanova, I do have a few things that I want to say, but also, Dr. Patel, I would like to address your question. I think the question is preceptorship and clinical site. Well, we do have something called preceptorship, and that's actually different from a clinical rotation. And that is in the final term. And with preceptorships, it's a 1-to-1. Or if you have a rotation, it really depends on the clinical partner. As my colleague, Renee Schweitzer, Dr. Schweitzer, so eloquently stated, that we are guests to our clinical partners who host us. So when they agree to allow us to be guests at their institution, they really dictate how many, when, where, etc. So our regulation does not stipulate a number, a ratio. It really all depends on the census acuity, the types of patients that there are, et cetera. It really is determined by also the program. But what we do is we're beholden to our hosts, the clinical partners. And if they say we only want in one rotation 4, then we hold to that. So we have one clinical instructor with 4 students. If somebody says, yes, bring in 10, then we could bring in 10. However, that is all very much specified, as Dr. Schweitzer said, in this EDPP form. It's a form that we have to have signed by every single clinical partner, not only to attest that they have the site available to us, but that they are not displacing anybody else. And then that form is then also signed after me, then by our NEC, who is our board representative, to ensure that that is an adequate site. So we're meeting all statutory guidelines, et cetera. I hope I answered your question.
Just want to add one thing. My name is Dr. Katie Kay. I'm the Vice President of Nursing Academics at West Coast. Working in staffing operations for over 10 years and through the pandemic, I just want to reiterate that we're not asking for more students than what we already have approved with our EDPs. We're just asking to continue our pattern of 220. And while we went through the history yesterday, dating back to 2013, it's a lot different time in 2023 now. I also want to just reiterate something else my colleague said yesterday, which is, we want a good relationship with the board, and that's what we're here to do today.
And if this is a good segue, I would like to share a few more things, especially a lot of the comments I really do appreciate. Well, good morning, first of all, but I do appreciate.
Excuse me.
Yes.
Dolores, is this time for board comment or a university? I just want to be clear about what's. You're muted, Dolores.
Sorry.
It's okay.
Nilu had asked a question, so I felt like they could answer it. But other than that, this is a time for board comment and questions.
And to be clear, the school is going to be given an opportunity to speak. So that's coming.
Is there any other questions or comments from the board? Mary?
I've been thinking about this a lot, and Tricia, I really appreciate when you opened up yesterday with saying how difficult of a situation this is. I've been on the board for over 3 years, and I've never faced anything that has been as difficult to try to get my head around how we got here and what the best path is to move forward. That being said, though, it's very difficult for me to believe that a program that is so well funded and with so many obviously competent team members and council was not aware of the requirement for the BRN to approve enrollment increases when hundreds of other programs have consistently complied with this regulation. West Coast shared that you thought you were complying and not being deceptive by reporting annual enrollment numbers to the board. And we also heard that there was some confusion about the process that was addressed with the guidelines that were issued in BRN in 2018. So that leads me to think that there's some path to understanding how we got there for 2018. But despite an improved enrollment of 1,500 students, West Coast expanded to 2,550 in the 2018-19 time, and that's when, granted, there may have been some confusion. But even after the guidelines clarifying West Coast what the process was, you continued to increase and is now requesting enrollment for 3,300 students, which is a 120% increase from the approved number. I mean, that's astronomical. The next closest program in California are 2 programs that are approved for close to 600 students. And almost all the others are approved for 200 or less, and many are less than 100. So now to request 3,300 students at a program that costs over $150,000 a year, when we as a board have either been denying or deferring requests for increases in the range of 30 to 120 students due to clinical impaction, and in many cases, much more affordable programs, is something I just cannot support. As Allison pointed out yesterday, NCLEX pass rates have steadily declined, and we know that as West Coast University's enrollment has increased, the performance has declined, and it's been significantly poorer than the average in the state. That's one of the things we're supposed to consider in our enrollment decisions. The other is that we know there's been issues with your clinical placements. Over 500 clinical placements had to be pulled, as we heard yesterday, because they were not approved or they were not appropriate places. And we've also heard from our nursing NECs that some of the pediatric placements, for example, are all done in a daycare center, and some of the med-surg ones were done all in memory care, which is not appropriate settings to prepare nurses to practice competently. So I am really, really moved by the letters of support that I have read from hospital administrators and elected officials, and all the materials, the comments from today and yesterday. But almost all of them are describing the impact that West Coast University's enrollment will have on the workforce. And as been stated previously, we are explicitly prohibited from considering workforce in issues for enrollment increase requests. So I think it also is important for the public to know that if we do decide not to approve West Coast at their current enrollment numbers, we have, as Lori mentioned yesterday, approved enrollment increases for over 3,000 students in Regions 7, 8, and 9 over the past 3 years. And these students will be joining the workforce soon. So hopefully that would mitigate any potential impact of a reduction in enrollment at West Coast. And I'm almost done. In public comment today and yesterday and previous board meetings, as well as our discussion yesterday about Homestead School's feasibility study request, we know other programs, state programs, community colleges, and privates would like to grow in Regions 7, 8, and 9 and have either been denied, deferred to another location, or probably never even made the request because they were aware of the clinical impaction issues. So, and importantly, as Dolores pointed out yesterday, the community colleges have funding to expand enrollment in these very affordable programs that are going to serve our underserved population and underrepresented. But they haven't been able to they won't be able to do this without adequate clinical placement opportunities. So we've heard from a lot of passionate students, but one of the main reasons they chose West Coast is because they didn't want to be on a wait list at one of the less expensive state or community college programs. Bringing West Coast University enrollment more in line with what was previously approved will open clinical rotations and afford other programs, such as these community college and state programs, as well as other private programs, to increase so that more students can be admitted. So, well, there's a part of me that would want to deny West Coast request altogether and have them return to the approved enrollment of 1,500. I think the program has made a case that they were confused about the process, at least until 2018. And West Coast was able to demonstrate, as Allison pointed out so clearly, that they did have positive NCLEX results that stayed above 90, at least through 2018 and 19 when the guidance was put out there, at an enrollment of 2,550. And so as a result, I would like to make a motion for consideration that we approve West Coast University at 170 students per campus, 5 times a year, for a total of 2,550 students annually, which is where they were when they were successful in 2018 and before that guidance came out, and that they would have 6 months to come in compliance with this number.
I'll second. That was Board Member Cormack.
I have something to say. Thank you, Mary, for your motion. The LA campus, we would do this with any other university that came before us with an enrollment increase but low NCLEX scores. The enrollment increase for the LA campus is provisional. So they will stay at 100 students per enrollment cycle until the increase in the NCLEX scores come out next year and are verified by the board. Until then, that increase for the LA campus will not take effect until those scores are verified.
For clarification, that is above 75, is that correct?
Yes, that is above 75%.
Okay. And it's the annual pass rate that would come out?
Annual pass rate, which I believe comes out around June.
It does. And you gave how many months to come into compliance?
I suggested 6 months.
Okay. 6 months would put them at May of next year. The annual pass rate would come out the following month at the end of June, so 2 months later. So understandably, just so the board is completely aware, that enrollment might just be limited for 2 months. Potentially just would be June and July. And I don't know if they have an enrollment cycle at that point. So I understand the intent, but I just want to make sure that the board is aware that it may have no effect at the LA campus if the Q1 results are indicative of West Coast's improvement and that LA comes above 75% in the reported numbers after close of June next year.
And I would just go ahead,
Dolores.
Go ahead, Reza.
Okay. First of all, I had a couple things real quick. First of all, just for the record in my notes, who chimed in and seconded the motion?
Board Member Cormack.
Okay. So there's a motion and a second. Obviously the school wants to speak. I presume maybe other board members also want to speak and respond. And now would be a time to do that. And then after all that, I'd like a chance to kind of see where we're at after the discussion and before we actually move on the motion, if that would be okay.
Sure.
Yes.
Madam President,
So what?
I have a comment,
Yeah.
please.
Go ahead.
Yeah, thanks very much. Mary, I had a long list of, and so I'm not going to go reiterate, except to thank the public very much for their input. And we do take your concerns seriously, but we have kind of a broader set of responsibilities, and that's to balance other schools' interests. But other than that, thank you, Mary, for your comments. They really reflected exactly where I'm coming from.
And I would like to mention before, I was going to mention this before Reza spoke, is that we've taken into consideration the statements that have been made by Ms. Piazza and about the hard work that West Coast University has done for the students and for improving those NCLEX scores. And we've also taken into consideration the statements made in public comment. They've not gone unheard. And we appreciate both the public comment input and the school's input on this difficult issue. So thank you.
Vicki, can I speak?
Yes, Vicki, thank you.
Yeah, I also want to thank Mary and Allison. I think they did a terrific job. In listening to a lot of the speakers, it seems like there's a belief that we can just increase enrollments without consideration of the fact there's a finite number of clinical placements. And I'm not sure if they understand that we would love to increase well beyond what we're capable of, but that there is this limiting factor. And I was wondering if, at least to the legislators who spoke and we received letters from, if the staff could send some kind of letter to them explaining the justification for whatever motion we take, and this fact that there is a limited number of placements, so that our decision making isn't just done willy-nilly, it's based on something that's a hard stop for us. So that was just a thought I had, because they clearly didn't seem to have that explained to them in whatever education they were getting. So just a thought.
Thank you, Vicki. Lori, can something like this be done?
I believe so, and I believe it's consistent. And so it is a overall enrollment increase. It takes it from 100 5 times a year to 175 times a year. That does increase them from 1,000 students on an annual basis per campus to, sorry, let me get my math out here real quick, to 500 students per campus annually to 850 students per campus annually. That then flips the 3 campuses from being at 1,500 students on an annual basis to 2,550. That's over a 50% increase. That's amazing, and the board has never done anything to that extent ever before. So it does absolutely show that the board is listening to that and doing that. It is a good thing to take into consideration, the low income pass rate at the LA campus. So I appreciate you guys did that. That allows us to stay consistent with what we do on a campus evaluation for whether or not enrollments can grow. And I think that it does allow for hope because, as was shared, the Q1 NCLEX pass rates do look good. So once the annual pass rate is there and reflects that they are above 75% at that campus, that they would be able to increase and be equal to every other campus that they have. So I think that is implementable. I've taken all the notes. Our team is taking the notes on this, and then I'm sure that after we hear from West Coast University that we'll be able to kind of move forward with that. It might be of benefit to go back out to public comment after that, just because this helped to formulate the decision. It might be good to hear what the public thinks after that decision has been proposed. I do want to make sure that I do clarify that although this is an increase for our board, that West Coast University will review this as the board approving 50 students less per enrollment cycle from what they currently have. That, in all understanding, would have an impact to their business. And that is something that is understood by the board. It does not affect current students. I want to make sure that that is very clear. The current students will continue to enroll. When West Coast considers that impact that number does, that changes them and affects the business side, and they consider to right size their support staff, including faculty, on making that work, that understand that we do have regulatory authority that does require them to have adequate number of faculty to teach out the students that are currently enrolled. And so that will need to be managed through their NEC, and reporting requirements when faculty are leaving is part of that. And we will have to be aware of everything that is going on with that as that is right sized. Thank you.
A question. Did you hear Vicky's request, and is that something we could do as far as reaching out with a letter to the legislators after this is all over, kind of explaining the process?
Can I jump in?
Yeah, thank you.
Sorry, Lori. Can I make sure I understood the request? That was to get input from the legislators who spoke up in support of this, and get their feedback on the motion. Is that kind of what the thought was?
Oh, no. What the thought was, this is Vicki.
Okay.
What the thought is that we had legislators writing letters and speaking who didn't seem to understand that there are a finite amount of placements. And so when we make decisions, we have to take that into consideration. And so I thought it would help them to understand that.
Got you.
that is an issue that doesn't seem to be part of what their education was.
So the idea, I think, to be kind of a communication from the board to those legislators to kind of help explain and help them understand how the board got there. one thought I just wanted to come back to. We have a motion and lots of discussion still to go. And as I said, I wanted to come back to the motion. First of all, just if I may, coming back to Mary, who made the motion, was I correct in understanding that your number that you had kind of put out there was based on the 2018 number?
Point at which it seemed like, there was the guidelines that came up by the board, that there legitimately could have been confusion about what the process was, that West Coast was reporting their annual numbers. But as of 2018, it should have been very, very clear about what the process, and they needed to request enrollment increases, as well as that seems to be the inflection point. And when the program was growing and the performance on NCLEX pass rates was declining, and more so than what was happening in the state as a result of the pandemic. So to me, it felt like that was the point to say you were performing well at 2550 and legitimately maybe didn't understand the process. But after that, you should have known the process and your performance was declining.
Thank you for that. There was a piece Dolores mentioned, which again, I want to come back to at the end about the one specific campus raising their I just want to get that officially built into the motion if that's the case. And let's just hold that. And then the last thing I wanted to mention is the board has a motion. I think Mary has explained her rationale pretty well. And again, there'll still be plenty of discussion to kind of guide what the board wants to do with that. It's not necessarily, required that you go this route, but you could consider putting the proposal today as a proposed action that the board intends to take, and allowing the school, say, up to 4 weeks to respond to it. And also you have an opportunity for, if the legislators, any other communication you wanted to take place between now and the next board meeting. And at the next board meeting, it could be brought back for kind of final either ratification or revision if depending on how the board wants to go. So just putting that out there in case there's any appetite for kind of testing the motion and seeing what the feelings are towards it between now and the next meeting. Again, though, I do think Mary rationalized her position well. And so, again, I'm not pushing that out there, just putting it out there.
And Lori, can you help me, remind me when will, because the thing is that open up some positions and allow some other programs that have been wanting to expand our new programs potentially to, continue with their feasibility study. But at what point, if we don't see an increase, would West Coast be able to come back and request an enrollment increase again?
Limiting number that says they have to wait a certain amount of time to request another enrollment increase. What we've even seen this year is we've had a couple programs come in and do an enrollment increase in February and just requested another enrollment increase at this board meeting or the prior board meeting. So the enrollment increase is directed by the school. If a school wants to do an enrollment increase, they reach out to the BRN, and then through the NEC that is evaluated and then brought forth to the board for consideration. And so it is completely school-led on whether or not they decide to do an enrollment increase and what that is and how much. So there is no limiting factor on that. When you're asking about when we think that there will be effect that the other schools will be able to consider that is palpable is when West Coast University adjusts their enrollments. And so if they are given 6 months to adjust the enrollment and they have a enrollment cycle at that 6-month mark, that is when we would expect that the approved enrollment increase number would be what would be enrolled. And then that would begin, and West Coast University has made clear to kind of differentiate to core nursing students And those core nursing students start in year 2 of that program. And so what I think we'll need further discussion, because that causes an issue with what the board recommends versus what West Coast does. And I'll try to break this down in as simple as possible. West Coast University takes into year 1 a number that we are not known what that number is. And if we decrease the core nursing students, the 220, and we say that are from 220 down to the 170, and we make that consistent with their terminology and address the 170 as core nursing students, then they have a plethora of students waiting in year 1 to get into year 2 that won't be able to get in. And those students already started year 1, and that could cause a problem with current students that are currently enrolled. So what BRN has typically done in the past is we do an enrollment increase that is not specific to core nursing students. And so if we were to be very clear with this, that 170 would be addressing somehow that first year student, because again, this is different than what any other campus that we've done, is where we talk about into the nursing program. Our 1426 includes general education courses as approved curriculum that we consider a nursing program. That includes the microbiology, the anatomy and physiology, the speech, the psych, the soc, etc. Those are general education classes that are offered year 1 with West Coast University. Because West Coast has chosen to delineate those terms, we have year 1 students that need to be accounted for that would go into that 220 that they currently have, that we're now saying is 170. So there's a potential of 50 students 5 times a year in that first transition year that could be caught in this. And so what I asked the board to consider is allowing for that. So I would give them a 1-year implementation versus a 6 months implementation, because that would allow for the students that are enrolled in year 1 to be able to matriculate into year 2, the current nursing students, the core nursing students that West Coast has, and have no effect. Because then at that point, when the board says 170, they can take the enrollment that they're doing now for year 1 to ensure that they can meet the 170 core nursing students for year 2. So instead of a 6-month implementation, I would ask the board to consider a 1-year implementation as to accommodate the students that West Coast brings in year 1, that they plan to have 220 5 times a year at each campus into core nursing, so that we can ensure that those students are not affected, and then put that other one moving forward. So just consideration there so that we can think of that.
Mary, would you like to amend your motion?
I'm happy to amend the motion to be 1 year instead of 6 months to come into compliance.
Yeah.
And I'm happy to accept that as a seconder.
Thank you. All right.
Before we, I still quite a bit of discussion to be had. Before we vote on the motion, let's just make sure we come back, make sure that it's exactly the way Mary and Allison intended to be.
Okay.
So far, my understanding is approving the increase up to the amount that Mary stated, with a 1-year period for them to get into compliance.
Yes, that's the amended motion.
This is Jovita. So I'm taking into account what you also said about the LA district. Would that be in consideration or not?
It is in consideration. It's a provisional increase based on their NCLEX scores.
Clarify that when I talked about the potential 2-month overlap that LA campus might have felt an impact pending annual NCLEX pass rates. By extending this out to a year, that gives them till November. And we will have annual NCLEX pass rates by then, with all expectation hearing what, hearing what Key Arena shared yesterday about their quarter ones, that LA campus might have no detrimental effect at all. The full expectation is for them to be above 75% come July of 2024, so that when they have to have this all figured out by November of 2024, LA campus will be right in line with every other campus.
Any other questions or comments from board members? All right, at this time, let's allow West Coast University that have been elevated to our panel speak.
Real quick, sorry. I guess for the school as much as for the board, is there any interest in a break before? I'm hearing the school or seeing the school nod yes.
Well, we'll defer to the board members. If you all need a break, absolutely.
Okay, why don't we take a 15 and come back?
How much, Dolores?
15.
Thank you.
So that would
So
put
10:50, call it.
Correct. Yeah.
14. Okay.
Thank you. Okay, we're back from break. Let's do a quick roll call to make sure we still have a quorum. So Dolores Trujillo present, Vice President Mary Fagan, Board Member Jovita Dominguez.
Jovita Dominguez present.
Board Member Trisha Wynn. Board Member David Lawler. Okay, we'll come back to David. Board Member Vicki Granowitz.
Granowitz present.
Board Member Allison Cormack. Board Member Nilu Patel.
Patel present.
Okay, I believe we still have a quorum. So we can go ahead and start. You know, we heard a lot yesterday. And this goes to the panelists that were elevated from West Coast University. If we can just limit it to responding to the facts that are on the table and the effects of this approved enrollment increase, we would like to also be considerate of the time that the public have and are waiting to give their public comments. Thank you.
Thank you, Madam President. You know, a lot of time was spent yesterday and today talking about the past. And we talked about what the enrollment number was that was assigned in 2013. We talked about West Coast enrollment caps and whether West Coast should have known its enrollments were capped. I heard very clearly Board Member Mary Fagan talking about what happened in 2018 and did West Coast know or understand in 2018? We talked yesterday about why the board didn't assign an enrollment pattern to West Coast in 2018, 19, 20, or even 21. And at one point yesterday, I heard one of the board members suggest that we shouldn't be looking forward, or we should be looking forward, not to the past. And I couldn't agree with that sentiment more. But this is really important for the board to understand before a vote's taken. This is a request for an enrollment increase that's different than any other enrollment application this board has ever considered. The typical enrollment increase application, the board is asked to make a lot of forward-looking projections. Will the resources be sufficient to support the requested increase? Will the school be able to hire faculty to train the students? Are the facilities sufficient to handle the increased enrollment? Will examination rates and graduation hold up to that increased enrollments? The board doesn't have to speculate or guess to any of those factors on this application today. West Coast has been and continues to successfully operate with the enrollment numbers we have today. You don't have to guess whether we have the resources to support the requested enrollment. We've already demonstrated that we do, and you've heard from students today tell you how great our resources and facilities are. You don't have to guess whether our students can secure clinical placements, because we've shown that they can, and you have a crosswalk that demonstrates that we have all the clinical resources necessary to educate our students. And you don't have to guess as to whether pass rates, graduation rates, and retention rates will remain in compliance, because you can see they already do. Today, as we sit before you, our schools meet all BRN and accrediting body standards as it relates to NCLEX passage rates, graduation rates, and retention. We can tick through each and every statutory factor, which is Executive Officer Melby so eloquently said at the beginning of today's meeting, are the only factors this board may consider. In each and every instance, when this board looks at those 4 factors, West Coast has demonstrated that it has the ability to train 3,300 nursing students. But I'm not asking you to take my word for it. You've heard from our hospital supporters too. And again, Board Member Fagan, I'm so grateful you took the time to read those letters of support. Who better to offer their opinion on the quality of our students and the adequacy of our nursing training than the hospitals that eagerly hire our employees or students after they graduate. And if you haven't read the letters of support, I really beg that you do. You'll see in those letters, many hospitals rely on our students to staff their nursing workforce. In many of those letters, you'll see anywhere from 30 to 40% of their staff, their nursing staff, is made up of West Coast grads. And they're telling you in those letters, cuts in our enrollment will make it difficult for them to make nursing ratios. And perhaps that's what CNA is looking for today. I've heard 2 things loud and clear over the course of this meeting. I heard the board does not want to reward bad behavior. That's how the meeting actually opened, with that comment from Board Member Nguyen. And this isn't about rewarding or punishing past conduct. The only issue before this board today is, does West Coast University have the ability to adequately train 3,300 students under the factors outlined in Section 2786? I heard one of the board members yesterday say something to the effect that dragging this out is pointless because we're going to be in another lawsuit anyway. And regrettably, you may be right. Rolling back our enrollments by 30% without any reasonable basis to do so is likely going to result in litigation. And if that's the case, the court's going to be looking at the transcript of today's proceedings and the objective evidence that the board used to make its decision. And nothing in Section 2786 or 1432 allows such a draconian enrollment rollback as is being voted on and motioned today. Today, in this board meeting, the board must state the reasons for its decision. You can't simply pay lip service to the statutory factors. The statute requires that you identify the specific facts and the specific evidence that causes the board to conclude West Coast doesn't meet one of the factors to support its current student population. And what I would mean by that is you can't just say West Coast is causing displacement. There has to be evidence of where the displacement is. And that displacement or the conclusion has to somehow be tethered to the vote or recommendation that you're voting on today. And I would implore each of you, to the extent that you second and vote on this motion, to identify the specific statutory factors you feel like West Coast is not meeting and the objective evidence that supports the belief and how it ties to the recommendation that enrollment pattern should be 170 students. It's obvious to me, and I'm sure it is to everyone, that West Coast University and the Board of Nursing needs to reset its relationship. And I'm willing, and I know our Dean of Nursing and our nursing educators are willing to do whatever it takes to make that happen. Dr. Piazza has walked through some really pertinent facts with you yesterday. She has some more information she wants to share today. And what she is sharing with you is pure data. It's pure objective evidence that proves we meet all the standards of the BRN and the Nursing Practice Act to educate our student nursing population. I would suggest to the board, if setting our enrollment numbers at 203 students per term, and that's the number that it was in 2021, and if I may, Board Member Fagan, 2018, while you feel like that was the line in the sand where it was perfectly clear, respectfully, it wasn't. In 2018, the board refused to grant the approval and refused to assign any enrollment number to West Coast. And that was despite letters and correspondence and requests for meetings, getting guidance and clarity as to what our enrollment pattern was. It's not until 2021, after this dispute ended, that we really are tethered to an enrollment number, which was 203 students per term. And that's exactly what you heard from the Attorney General in that case, that West Coast University has the resources to educate its students. And if it follows the process that the board is requesting and goes before the board, he sees no reason that the board wouldn't grant that application. And that, in my mind, that 2021 date with the 203 students per term is the objective moment of clarity, if we could. And so I would ask the board to consider that as a possibility. With that, I'll turn it over to Dean Piazza, who has some additional information that she thinks is important for the board to understand.
Before Dean Piazza speaks, I would encourage you to also be cognizant that there are members in public comment that are waiting to speak also, and their time is valuable to them. Thank you, Ms. Piazza.
Thank you. And I do thank all of the public members and comments in favor and not for taking the time. This is important. And I do recognize that the board is anxious to get going. I know the vote's already been cast. It seems like it was already even before we spoke. I was even impressed yesterday at how we sailed through all of those consent items without a discussion, but yet we've now dedicated hours to this. And I do believe it is important. There are 1,200 students who are already enrolled and in the pipeline for January and June. And they are all excited to start, not to mention all the jobs of faculty and staff that are now on the line. And so the board does deserve to hear the facts. So while I do appreciate the need to be expeditious here, I am confident that the board is going to allow me just to present those 4 facts that are necessary for a determination of a vote today. And I'm also confident that the board is not going to take their opinion of me, any affinity to any type of institution, whether for-profit or not, whether ADN or BSN, any type of business practice that they might oppose. I am confident that the board is just going to make a decision based on these 4 things. And I'm really grateful to board member Cormick, who detailed it yesterday. And those are the adequacy of resources, clinical placements, complaints that have been verified, and licensing exam rates. So let me start with these, and I'm going to try to go as quickly as I can. And because of that, I'm not going to belabor the adequacy of resources. And actually, I think that's part of the complaints, is that we have too much resources. We've got we've got the state-of-the-art skills labs. We've got a lot of things. And so I'm not going to spend too much time on that. I think we've already covered that. Let's talk about the availability of clinical placement. So I've heard a lot of comment that we are operating in a clinically impacted area. But all of that to me so far has been innuendo. Like even the speaker today, and I respect what she had to say, when it seemed like there was, Reza, I think you were trying to tie her comment that West Coast was the reason why they're being displaced. When she was able to come back on the line, she actually clarified that it wasn't West Coast. It was just private institutions like West Coast. There was nothing tied to fact. Instead, we are a leader in nursing education, but we earned that. We've been in operation now for over 10 years as a BSN program. And as my colleague, Dr. Schweitzer mentioned, every single clinical connection that we have was done through relationship building. And we also know full well that those relationships can be tenuous. We have to continue to earn our ability to be guests at our hosts. And so we have to work all the time. We listen to what they have to say. When we invite them to our PAC meetings and they tell us we need more nurses, we give them more nurses. But we also understand that just because a program knocks on our clinical partners' doors, they're not beholden to opening the doors to us. So I just needed to put in that plug. But regarding clinical displacements, because we talk a lot about that, but if you actually look at 2786, and I'm not going to school the board on the regulation, but I'm just letting you know what I see. It does not identify clinical displacement as a valid consideration in connection with an enrollment increase request. It's nuanced. If you don't see it, really the question that they're saying is that, is there sufficient clinical placement available to support all of our students? And we have shown that we have more than sufficient clinical placements to support the 3,300 students that we have, that we've already enrolled this year. And that proof is in the application. And Mr. Casanova did mention, I'm going to reiterate again, that there is a grid, a clinical crosswalk. I know it's not available in the materials, but I was informed by our NEC that if the board members have any requests to see it, that you can. So I really encourage you to look at that. We have placed every single student that we have. Clinical placement is not an issue. So we do work hard, but not only in cultivating clinical relationships, but we also work hard in not displacing. Let's just talk about displacement for a minute. And the reason that we do that is because we are keenly aware that there are other great programs and our students have cousins, have children who go to other programs. We know that. We also want to be partners in providing nurses and providing our students access. So what we've done, and we've done from the very beginning, and we continue to do this, we take the night shifts, we take the evening shifts, we take all the non-traditional shifts that are offered to us to be able to allow other schools the ability to come in whenever, maybe at a time that's better for them. It was also discussed, that form, and I appreciate Executive Officer Melby's comment that it's a form that the BRN has where the clinical partner attests that there's been no clinical displacement, but this form is useless. It hasn't worked for 8 years, which to me is a shame, because we're asking our clinical partners to take the time to fill out this form and sign it. And so we go through the process. I sign it, our NEC signs it. So everything that we do meets statutory guidelines. Everything that we do, all the forms that we need to sign, we have them signed. More importantly, though, we also make sure that when we are asking for clinical rotations at these acute sites, especially the pediatric sites, we're utilizing an electronic placement system. And what that means is that whenever we make a request for a rotation, the system only identifies rotations that are available and that are not in another school's rotation. And that what that means is that the site is reviewing all the rotation requests to prevent displacement. And then consortia. We've got, at the 3 regions where we operate, there are clinical consortiums, and we belong to every single one of them. We've belonged for years, for more than a decade. So we are out there in the community. We are asking what the need is. So for the comment yesterday that, we're kind of isolated and working on our own, that's just not true. And I need to say that because we have a very robust clinical team that works very hard. And for me to not mention all of their hard work, I think I needed to mention that. Regarding the crosswalk that I had mentioned before, you'll see that not only are we meeting our current enrollments, but we're doing it in a diverse clinical environment. Now, if there is a school, if there is a program that says, look, you are displacing me, or there is a conflict, I'd like to hear from you. I'll give you an example. The dean from Golden West, she called me and she said, Karina, I have students who want to go on this day. It looks like you might be going that day too. So we worked it out. And now we have students on her end and on my end that are getting all their clinical hours. I ask all the other program directors to do the same. Give us a call, let us know which site that they are being displaced from, the date, the specific rotation, and we will address it. That is what we want to do. Mr. Casanova said, We want to make sure that we are good community partners. That's not lip service. I look forward for all of this to be over so that I could actually get to that work, to be out there, to work with everybody, private institutions, public institutions, ADN, BSN. That's what I want to do. Now, we've heard also reference to regional impaction and the data above about the overall amount of displacement that has occurred in certain regions. But again, that's speculation. Without material proof, without any material fact of specific displacement, the board cannot utilize that information to determine the vote today. Otherwise, it's just hearsay, it's just rumor, and what we need is material proof. All right, I'm up to verified complaints. I'm almost done. West Coast University, as I stated yesterday, we do not know of any verified complaints that are filed against us with our accreditors, with our regulatory agencies. We don't have any litigation or administrative charges pending with any of our existing students. And I'm not talking about day-to-day complaints. We have all that, and I'm not talking about the Yelp reviews. Because I think we could all agree, right, that if Yelp reviews and if Google reviews and all of these other reviews were determined as verified, then I think the board would also be concerned, because looking at their Google review at 1.5 stars, I'm having to defend the BRN to our students who are complaining about the length of time it takes them, even their fingerprints and everything else to get cleared. So what I'm discussing here is not just day-to-day complaints that we take care of on a day-to-day basis. I'm talking about verified complaints logged with the board. And I work closely with our NEC, and I ask her if there are or any hint of one, please let me know so that we could start to address it. Now, Executive Officer Mel B yesterday discussed concerns with WCU's telehealth program. Let me just give you some context to that. Back in March of 2021, a couple years ago, 2.5 years ago, West Coast was asked to provide a variety of documentation and information related to the telehealth program that we had at that time during COVID. And so just like by way of background, in 2020, West Coast University worked with our then NEC, Wayne Boyer. He approved every single telehealth option that we had to meet that transition that Governor gave us from 75% to 50% direct patient care with all the waivers, et cetera, during the pandemic. And all of those clinical rotations were approved, and we were compliant with our regulation. Mr. Boyer even said, we are the wave of the future. When Executive Officer Mel B asked us instead to provide the information to close down shop there, we did. It was resolved, and there was no further action taken by the board. That was back 2.5 years ago, almost 3 years ago. We're at 2023. West Coast University is no longer utilizing telehealth the way it was back then, because we've moved on. Our students are back in direct patient care. They're back in the classrooms. And this was the only known verified complaint that we've received from the board in the last 5 years. And then again, here, that's no reason to deny our application. The board needs to investigate and validate complaints for them to meet anything under the statute. And if there is a verified complaint that hasn't been fully addressed or that I'm not completely aware of, please let me know. And again, I'm willing to work with you. I think Mary Jane can attest to that. There's never a time where I have been resistant. I'm a director of a very large program. That is not lost on me. Where West Coast goes, so goes the state. So when we were doing very well with NCLEX, and I remember sitting at the board meetings and the representative would say, oh, when California beat all these other states in the nation, I would secretly pat myself in the back and high five my colleagues, because I'd say, because we did that. Because we're so big, we raised the average. So we understand what it means to hold the bar high. We must, because California counts on it too. So let's talk about NCLEX. 1431, the Nurse Practice Act, the benchmark for NCLEX is 75%. I'm not going to go through again how good we are, or we were, and we are now with NCLEX, but I do want to address the fact that there seems to be this desire to marry completely our numbers with our decline. I'm not going to deny that there is this inverse relationship, But I also want to remind everybody that there is much more to numbers of students that goes into NCLEX pass rates. Executive Officer Melby said yesterday, utilizing NCLEX test takers it's kind of a, it's a touchy subject because it's not a one-for-one. You could have somebody who graduated 10 years ago and they come back and then they end up testing. While I am not going to go through all of the reasons why, it could have been because a blueprint changed, so many different reasons why, what's most important is for everybody here to understand that currently LA, and that's really the point of contention that I'm hearing, which is only a subset of our total program, one time in ever of our history did it go down below 75%. And we could tell you mathematically why. And we changed that. And as we all know, NCLEX is a lag metric. So what that means is if we can't just flip a switch and then tomorrow NCLEX is magically back up, but we can track exactly what we did. And the biggest thing that we did is we brought those students back to campus. And unfortunately, we weren't able to do that until after the other campuses, and which is why you see them lagging behind. But right now, they are the comeback kid story because they are climbing back up. Last time, they're at 86%. We just graduated a whole set of new graduates. So administrators out there who are listening, they're coming to you and they're happy to get jobs from you, and they are passing NCLEX. So I have every confidence that there really isn't the relationship that everybody wants to put with NCLEX and our enrollments, because then why else would we right now have logged in 2 to 3 quarters that are at more than 90%. So fourth quarter, just as a reminder, we've returned to 93.6%. And right now, year to date, we're at 91.5% and climbing. But regardless, the point that I want to hit hard here is that we are viewed as one institution. And as one institution, if you look at that website, we have never dipped below 75%. We have remained. The lowest we've ever gotten was 80%. Then we've increased up to 81%. I am really excited to see and to show everybody that we're going to be going back up to where we are accustomed to be. Not only that, we're meeting all of our accreditors, benchmarks, and I think what's lost in this whole mix, because we talk a lot about numbers, and even those students are the ones who go to take the test, are faculty. Our faculty, the faculty are the ones who make it happen. They're the ones who review the curriculum, who analyze all the data. We utilize ATI, and ATI provides us a lot of resources, a lot of metrics, and we utilize every single one of them to see where it is that we could be better. So we're not just shooting in the dark. We're utilizing data to inform our curriculum, and our faculty do that. They introduce changes in teaching methods. We do a lot of training. Now there's a lot of talk about AI. We're doing training on that. We have an innovation lab. We've got our state-of-the-art simulation centers, which are accredited. Our faculty run all that. And a lot of times these are faculty who are able to take the qualification that they get from us. And I'd love to do a study to see how many faculty out there in California started with West Coast, got qualified as either an assistant instructor or as an instructor, and went and took that and was able to go to another program, able to go to the community colleges and serve. We take pride in that. And since we are able to do that, we have the resources to do that. We're happy to do that. We're happy to be able to develop faculty and share them. And we all know that faculty, especially our adjuncts, they work in different places. Not only do they work in service in the hospital, but they also work in other programs. So in closing with NCLEX, I just wanted to share that, we just had next generation NCLEX for our new board members, those who are not nurses. It's basically a way of identifying clinical judgment for students when they are going out and becoming new nurses. That was just a deficit that our employers were saying, that the old way of NCLEX was not hitting the mark. Again, as soon as it was even a whisper in the ethers that there was this thing coming called NGN, NCLEX, Next Gen NCLEX, West Coast, we jumped on it. And we've been training and educating our students and our faculty for the last 3 years ad nauseum. I know they're tired of hearing from it. But if you look at our If you look at our pass rates, we've got scores over 93% since NGN came out. And I know a lot of our colleagues the same. Why? Because everybody kind of jumped on the bandwagon. So we are all, in my opinion, in this together. And I just would like for everybody to know that I would like to continue this collaboration and that we are a great nursing program. We want to be a good relation partner, not only to other programs, but also to the board. And as I was mentioning earlier to Executive Officer Melby, we did enjoy being, there was even a pilot that's now put on hold, and it's a clinical automation of, those EDPs. We're excited and stand at the ready. When you need us, we're ready again to jump back in. So despite the comments of board member Vicki Granowitz, we don't want a lawsuit on this issue. We really don't. We want to do what we do best, which is to educate students and provide access to all those students who want to be nurses. We want to protect our faculty, we want to protect our students, and move forward with this, with our approval. So as Executive Officer Melby said that in 2021, at the end of that lawsuit, when in my opinion, it was the clearest, that was when it was clear, when all of a sudden it was clear at the end of that lawsuit what needed to happen, even though it wasn't codified in regulation until early of this year. But at that juncture, we were had an enrollment pattern of 203 students per term. We clearly have the staff and the faculty and the resources to educate student enrollment at that level. And while that would still be a huge, huge rollback for us, that would be what, let me just do the math, 203, that would almost open up almost 300 clinical sites for our community colleges and for others if we were rolled back to 203 at that time, at the end of that first lawsuit. I can't guarantee that the clinical partners will invite you, but at least it opens it up, right? As Dr. Schweitzer mentioned, that's really the choice of the clinical partners. So before making your vote today, I ask you to consider the impact that your vote will have on numerous lives. The impact on our nursing students, the impact it'll have on hundreds of faculty, including the future faculty pipeline, and the impact that it'll have on hospitals and communities that our graduates serve. And now I'm going to hand over the microphone to our Vice President, Dr. Katie Kay, and I thank this board for listening.
Thank you, Ms. Piazza. I just want to correct one thing, and then I'll let you speak, Ms. Kay. Statute doesn't say NCLEX needs to be below 75 to take into consideration for enrollment increase. Your NCLEX scores have been declining over a period of time. And we look at that for any college that comes to us and requests an enrollment increase. So I just wanted to clarify that point. Thank you. Ms. Kay?
Thank you, and thank you for giving me the opportunity to speak. As I said earlier, I tend to be a very objective person when I look at the situation at hand. And, in this situation, we already have the sites approved. We've discussed that. These sites are approved, in fact, by this board. We also have pass rates that are currently over 90%, and demonstrating that we are where we need to be, and in fact, aligned with the national average. Further, we have attrition and retention rates that either meet or exceed not one, but two programmatic accreditors. And last, and I think that we've talked about this at length, so I don't want to hold up the board's time, but we have no verified complaints. So when we look objectively at what we're discussing today and what we're requesting today, I think that we've really discussed fully how we're meeting the needs of the students at the 203 population that we've discussed. Thank you.
May I ask a question before we go to public comment to that correction, Ms. Trujillo?
Sure.
Okay. So if we were to go back, and thank you for that feedback. So if we were to look at that website that's on the BRN that shows all of our schools, and it shows the schools that have fluctuated way below, not even fluctuated, but like have been below 75% or at 75%, can I go back to my students and say, yeah, we're not held to a different standard? Because they continue to remain on the docket as approved programs. Not even approved programs, I don't see their enrollments be rolled back or decreased. So when I look at some, and I'm not gonna, I don't want to name any names, but like School A, 71% in 2021, and then 64% in the so the other one was 2020, 21, then 64%, 21, 22, and then they're still there. School B, 75%, 74, 72, 64, 76. School C, 63. I mean, we could go on and on, but 57, 64, 73, 70. I just want to be able to, as the director, be able to go back to the students, because we're gonna have to have communication with students and with faculty and explain why it is that when there are schools out there visibly below benchmark, the appearance is nothing is being done with them. And here we are, where we've always met benchmark, if not exceeded it by 5% at the lowest as an institution, why it is that we're being singled out in this way.
Are you done?
I'm finished, thank you.
You're not being singled out, but I will defer to Lori, our executive officer, to comment.
An increase in NCLEX pass rate below 75 threshold are two separate regulations. Enrollment increase is under substantive change request in 16 CCR 1432, and that is a request that is brought forward by the school. NCLEX pass rates that drop below our 75% threshold are considered under a different regulation. That regulation states that at 1 year, one annual year less than 75%, an action plan is done between the NEC and the program director. If it goes to 2 years, a site visit is done and another action plan is done, and it's brought in front of our board. Those are two separate things, and I hope that you're able to consider them as two separate things so that you are accurate when you go back and speak with your students about this. Those have zero correlation. An enrollment increase is a request by the school, and at any given time that is considered as an individual request and reviewed, and all factors outlined in the statute are taken into consideration. That statute does not say that you have to be less than 75 for the board to take that into consideration. Separate from that is the pre-licensure process that is utilized for managing schools that fall below 75%. Schools that fall below 75% follow the regulatory guidance, work with the NEC and the board to come back into compliance with that. What you will see is that is addressed with the continuing approval visits. If at the continuing approval visits, we find that our campuses, any of them, are in a non-compliance with any of our rules and regulations, action is deferred. And we allow the program time to come into compliance. Exactly what we have done with West Coast University. In 2018, we found you to be in non-compliance with a few regulations. We've allowed you 5 years to come back into compliance. Now that you guys are here requesting an enrollment increase, that was your final step to come back into compliance. We commend you on that. And we hope that when we see you in the spring at your continuing approval visit, that we will be able to grant you full 5-year approval, or actually your CCNE approved, an approval that will be identical to the years that your accreditor provides to you. So you're in the right step. If you have any other questions on how to interpret the regulations, and if you find a correlation that you think is occurring, please reach out and ask, and I will be sure to clarify that with you so that you'll know that those are two separate and they are not considered similar at all.
And Ms. Melby, thank you for that invitation, because I do believe that there was a school that was approved for increased enrollment with below benchmark. So, but that we could take offline. I don't want to name out the school, but there was, at least we have evidence of that. Thank you.
Thank you.
All right. At this time, we have a motion and a second on the table. We've heard from the representatives that have been elevated. Let's open it up for public comment. BRN moderator, can you please open up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Please also submit your request one time. We will get to you.
Board moderator, at this moment, while you're going through that queue, I will take a moment. I did receive a public comment in my email. They were not able to attend, so I will read what was shared. It says, "To the BRN, my name is Deborah Guisto, Giusto. I am from City College of San Francisco. I am currently the assistant director and a faculty member. For the past 2.5 years, I was program director. West Coast University is requesting to increase their enrollment. In the past, the university has had an unauthorized enrollment increase, demonstrating their lack of respect and trust to others. Allowing the university to increase their enrollment will have a negative impact on the ADN programs obtaining or maintaining clinical sites and potentially unable to increase their cohorts, which can cause a decrease in their enrollment. This will have an impact on the communities they serve, those students who cannot afford to attend a private university. I urge you to not approve an increase in enrollment for West Coast University. Thank you, Deborah Mendez Guisto, RN, MSN, IBCLC, Assistant Director, City College of San Francisco." Thank you.
Thank you, Lori.
Thank you. Ali Perez would like to make a comment. 1 second, please.
Just correct my name really quick. It is Alan Perez. As the board will know, in February, I was elevated to the assistant director of the program here in North Hollywood. And thank you very much for giving me the opportunity to make public comment. I am not here to discuss the lawsuit. I did want to give the board a little bit of indication of what has been happening since I became the dean of the campus at North Hollywood. And when I first came on board, I was very disheartened when I walked into the campus. It was very few people were around, and we were just coming back from the pandemic, and it was clear that everybody had been affected by the pandemic. My very first action was to understand what was going on, and faculty who had taught online for 3 years were very dejected, very disconnected. And so we've done a lot of healing on the campus. We're also getting our arms around making sure that every student is receiving the amount of clinical judgment making that they need to be able to be successful as nurses. And so we started looking at the curriculum as well to make sure that everything was being done correct. We have a content gap analysis that happens at the end of every single term, and we return to faculty and come up with new ways of teaching to ensure that we are meeting the needs of our students. And it's been successful. You'll see as our NCLEX rates are going up that we are being successful in that model. We are a good community member. We do want to continue our community partnerships, and I look forward to the time when I can sit down with the fellow deans of nursing here in my area and talk about what the needs are for everybody so that we can address the nursing shortage. This isn't about nursing shortage. This is about nursing education. We are taking the steps necessary to ensure that our students receive a proper education and that they are well qualified and that we are bridging the gap between theory and practice. Thank you for allowing me to make public comment.
Thank you for your comment. Mary Steckler would like to make a comment. 1 second, please.
Speak. This is Mary Steckler from Santa Ana College. I apologize. I did not make the meeting yesterday. So if I feel like I'm repeating what was said yesterday, please bear with me. But I do have one comment. Dr. Piazza mentioned today that clinical placement is not an issue. I took that very hard because clinical placement is an issue. I think what we need to talk about is the difference between clinical placement and clinical displacement. Because 3 or 4 years ago, Santa Ana College experienced several clinical displacements, predominantly in pediatrics and OB and a few other disciplines. It has been 4 years to this day that we're still trying to find a permanent clinical placement for those displacements 3 or 4 years ago. So I find it hard to believe that West Coast can find all these clinical placements with no problem, but yet the community college cannot. I urge you, board. I mean, I can talk forever. I've been on this call several times talking about the impact in Orange County and how Santa Ana College is being heavily impacted. And I just really feel like we're not being heard. We can't grow. We want to grow. We have 600 applicants right now that want to come into our program. Just this one application period. We can only accept 60. In the spring, we can only accept 40. And trust me, I've reached out to all the hospitals, and you know what the hospitals say? No, we don't have any room for you. So how can they say no to me, but yet West Coast, they're saying yes? I don't understand it. So please, I urge you, please do not approve this increase. Thank you.
Thank you for your comment. Carmen Comsty would like to make a comment. 1 second, please.
Lead regulatory policy specialist from the California Nurses Association. The motion before the board to bring West Coast down to its 2018 levels is reasonable, measured, and data supported, with the exception appropriately identified by Board President Trujillo that the LA campus must bring their NCLEX scores back up to board requirements. We urge the board to make clear that increases in the LA campus should be deferred until it can, and only if it can demonstrate that it meets minimum NCLEX and other board standards. Schools must not disregard the authority of the board to review enrollment increases and to consider the ongoing ability of California to educate appropriately qualified students, and to consider the impact of clinical placements, as you have done time and again with other schools' requests. We appreciate the board's discussion and recognition of low NCLEX and high attrition rates at West Coast overall, which are concerningly acute at the LA campus. It is increasingly incredibly important that the board upholds its role in protecting the public by maintaining education standards and ensuring that precious clinical slots are being used to train students who will ultimately be successful in becoming RNs licensed by this board. The evidence from past denials and enrollment increases in Regions 7, 8, and 9, BRN annual school reports, and clear intent from community colleges in California that there have been and will be other schools looking to expand their clinical placements, but the board will not be able to approve these increases because of West Coast continued expansion in clear disregard of legal requirements and authority of the board that was, of course, confirmed by the courts to review enrollments increases of the scale. We deeply appreciate your persistently thoughtful review. Thank you very much.
Thank you for your comment. Ima would like to make a comment. 1 second, please.
Hello, can you hear me now?
Yes, ma'am. Go ahead.
It's been difficult trying to connect, but I just want to say the last speaker spoke my mind, and I also want to thank the BRN panel member, Mary. Your analysis clearly demonstrates, where I stand on this issue. To say that there's no clinical displacement is not true. I am here on ground in the Antelope Valley, and our students are displaced, especially obstetrics and pediatrics clinical. It is difficult to get clinical rotation. They have been, and someone may say, oh no, there's no data to back that up, but I can say it because I work in that hospital. There have been, talks about West Coast giving kickbacks to the hospitals. I work in one of the hospitals, so I know what I'm talking about. However, my take is that please, this expansion should not be approved, at least not at this time. Our students are being displaced. We also need the environment. We also need to grow and thrive. That expansion is going to bring significant impact to the displacement of students clinically. Thank you.
Thank you for your comment. Ani would like to make a comment. 1 second, please. Go ahead.
Okay, thank you so much. I appreciate it. This is actually Samantha Gerard from Southwestern College in San Diego County. This is to the BRN. I'm vehemently opposed to increasing West Coast program enrollment. Every day I continue to receive rejections for student placements in San Diego County. It used to be specialty only, pediatrics and obstetrics and psych, and now it's occurring in all med-surg areas and across all of my allied health programs. That's surgical technology. I realize that doesn't apply to this, but it just tells us that the system is bursting at the seams in San Diego County. Please do not approve this without further data and further investigation. We have been clinically displaced since spring of 2022. So this is not an unusual occurrence. It is an everyday occurrence for us. And when large programs in the LA area and other areas can't find placements in their area, they spread out. And this is a diaspora that we cannot accommodate down here in San Diego County. Thank you so much.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments. Would you like me to close this window?
Yes, thank you. Okay, we have a motion on the table with a second. We will take it to a vote. Before we
go to vote, we will need to restate the motion. It's been quite a long time and there was a lot of discussion around that.
I was just going to say that.
Thank you. I'll yield the floor to Reza at this point.
I was going to say, for one thing, please restate the motion. I'm not sure that the piece about the specific campus with the NCLEX issue was officially incorporated. So if I think Mary and Allison wish to incorporate that, then please amend the motion. And then lastly, just circling back to the notion of either moving with this motion as stated or revising it to be a proposed action with the opportunity for West Coast to respond within, say, 4 weeks, and then board staff to issue a further response to that and ratification at the next board meeting. So that's up to Mary and Allison with input from board members.
Reza, can you speak a little more to what would be the impact of postponing this until the next board meeting? I'm not clear on what that would.
The idea of doing it as kind of a proposed decision and soliciting responses from the parties. Of course, it wouldn't be, I don't suggest that it be mandatory that West Coast issue a response, but just giving them the opportunity if they wish to, take more time and consider the motion and their information and their position that they want to take and issue a thought out response to it. And then giving, the board the similar opportunity in light of their response and then circling back to it.
I think there's another option as well, Reza, which has been done previously when a board has issued a enrollment or a motion that seemed to negatively affect the school. And we did this, I believe, a year ago, where the board made the motion, it went to public comment, it came back and went through a vote. That school then requested to come back in front of the board, and that is a normal process that we have. So if we wanted to stay consistent, an option could be that our board makes the motion like they've done, got the second, like we have, gone out to public comment, take the vote. If the vote successfully passes and the school has issue with it, the school can request to come back to the next board meeting in February and go ahead and go through the same process again. We actually did that. I believe it was with ELAC potentially. I'm not 100% sure, but it was a year or two ago that we've done that. So I just wanted to throw out that there is also other alternatives that can be done. Whenever a board issues a decision, that decision is only binding until another board motion is presented and approved and moved. So at any point, schools have the ability to come in and state their case, and it's brought in front of our board. This is not something that cannot be amended in the future, even if our board decides to make a motion today and not allow for a proposed motion and then feedback.
This is Board Member Cormack. Can I ask a clarifying question about that? Is that what you just described, Executive Director Melby, a different process than the process whereby an applicant can return after an enrollment approval and request a subsequent one? So we've seen that happen already twice. We did it yesterday. Is what you're describing a different process?
It is. It's a different process outside of enrollment increase, right? We're talking about today because today is an enrollment increase. But at any point that our board issues a motion and it is ratified and passed, if a school does not agree with that motion, they reach out to their NEC. They're added to a board agenda or an ELC, and we reopen that same request. And that was done, I believe it was June 2 years ago, where we had stated this and they asked the board to reconsider. We brought them to the very next board meeting and the board reconsidered and then ultimately confirmed their decision. That is separate from the one
interpreting that under the fair and consistent application of the statutes and regulations. If the board takes action today, then there is a process that people can use. Okay, thanks.
There's always a process that they can come back and question anything that our board has done. They can provide input at any point. That is separate from the proposal that Reza suggested. Reza suggested that
a separate proposal. Lori, can I?
Yes.
It sounds like what you're describing is essentially them submitting another enrollment increase request.
No, that is separate. That is when they don't agree with the board's motion and they request to have it reheard. I'm desperately looking through our website right now to find the example of that to share with you, Reza, so that you understand which one I'm referring to.
There is no appeal process in the regulations, just to be clear. And the vote that's on the table is impacting 700 students immediately.
This is Jovita Dominguez, but this is not an easy situation. And please clarify if I'm comprehending this incorrectly, but maybe bringing it to the February, like deterring to February board meeting, that would give us more. I mean, I've read the information, but maybe we all need to individually think about this till February, because honestly, it is impacting the LA district. And EO Melby, I do remember, because it was a very hard decision for me to bring ELAC to stop enrollment, because they service a community that only they understand. And I'm speaking from experience from my community, because people that come from outside our community, they don't understand our community, because it's, unfortunately, high diabetes, homeless, a lot of homeless that come from different areas, because they hear about all our from a lack of a better word, we have resources here. And the homeless, they talk to each other and they come to our community, and we have to, our community is a district community, and we service them with open arms. So here's what the reason I say that, because we actually put ELAC in a position where they didn't want to be, and they surpassed it. So why? I'm just asking the board members to think about it, and maybe we need to really reread these situations and bring it back to February, because I mean, I'm just putting myself in the same situation, because in Monterey County, we're in a special position, and I'm pretty sure ELAC, they service students that can never afford a private college. And honestly, the people that live in that area stay in that area, which we have seen in many years here in our area. They come from either San Diego, LA, San Francisco, and it's human nature to go back to home because that's where their families are and they want to spend time with their own families. That's just my personal opinion, because I live in this area where we've seen people come from different areas and they don't even last a year. They go back to home. And do I blame them? Personally, I do not, because I grew up in the area. And if I was to go to those other areas, I would come back home, because I did, even before pre-Rex, because it's natural to want to be where your family is, the majority of your family. So I don't know, maybe that's my personal opinion, and the board members don't have to listen to what I say. I mean, that they have their own conscience.
Thank you, Jovita.
Dolores, can I comment?
I want to make sure the board members, David, I want to make sure the board members have had an opportunity to comment first, Scott. Go ahead, David.
I will respectfully disagree with.
Excuse me?
I'm disagreeing with Jovita to put this off until February. And I also, if you want my opinion, don't agree with making it a proposed motion to bring back at another board meeting to give anyone any more time to respond, solely because in the 5 hours combined that we've had on this for the last 2 days, their position has been very clear, and they've done a very good job in stating their position. And I don't see how that's going to change between now and then. And I would personally like to go with Mary's motion and just take the vote.
Dolores, this is Vicki.
Yes. Thanks. Thank you for waiting, Vicki.
I agree with everything David said. Additionally, in spite of what Ms. Piazza said, her colleague also still was very clear saying that they would consider a lawsuit. We have spent plenty of time on this. This is not the same situation as what Jovita is talking about. If it was, I would agree with her, but it's not. I think that they are lucky that Mary has come up with a compromise, because I would have certainly been willing to vote to bring them back to the original numbers. And so the fact that a compromise has been arrived at is pretty much of a gift. And it's sad to me that this isn't how it's being seen, that we've tried to do the right thing. So I'd like to just let the board finish talking and then take a vote.
Okay. Any other questions or comments from the board?
Yeah, I just want to reiterate, because I do want it for public comment, that, for public record, that, there is a process in place for the board to consider, right? In order to maintain this process of over 100 plus schools in this state, we have to really consider the process. So under current legislation that took effect January 1st of this year, The following, under the Business and Professions Code, Section 2786.2, Subdivision B1F. I know we've gone over this, but I would like to repeat. When considering a request to increase enrollment, the board considers factors related to the ability to adequately train additional students. And in point 3, it's the availability of clinical placements. I know West Coast University diligently answered the questions that I had before with Ms. Piazza and Dr. K, letting me know that there is an issue there, but we've heard from many public commenters that there is an issue with clinical placement sites. And so, although I don't like to, not have action or kick the can down the road, but I think it's imperative for the board to do further due diligence around clinical placement sites. We've heard 2 opposing viewpoints, and I think we need to go through our process and ensure that what we're hearing is accurate before we make a decision.
Thank you, Neela. Reza? Reza?
Yes.
Was there something you wanted to say before we vote?
Unless there's any questions anyone has, I would just ask that you restate the motion and have Mary and Allison confirm. And yeah.
Okay. So
the motion, Dolores, I did want to make sure that I addressed one comment very quickly.
Sure.
West Coast University's legal counsel said again that this is affecting 750 students immediately. I need to reiterate that this is not the intention of the board. The board is giving a 1-year delayed implementation for them to come into compliance with the approved enrollment increase. That under no circumstances is that intended to be interpreted that today they need to kick out 750 students at all. That is not what is being requested by the board in any fashion. So is this board's motion that is on the table today is for future enrollments. It is for people that may want to become nurses in the future who have not even chosen to attend West Coast University yet. They could be looking at any school throughout our state or within the nation. It is not current students at West Coast University, and they need to make sure that that is very, very clear.
And Executive Melby, if I could clarify,
Yeah,
it seems like
please.
seems like
Yeah,
sure.
Go ahead and finish, Lori.
Thank you. The other question that their legal counsel or concern the legal counsel had brought forward that I do think is relevant to address is he mentioned the prior lawsuit that said by the Attorney General that they don't see any reason why the board would not grant full approval. That lawsuit had a tentative ruling in March of 2021. As of that point, per the timeline provided by West Coast University, they were enrolling less than 200 students. I believe it said 197 students. And so the board has approved 170 students. That's the motion that's on the table. If the board wishes to consider that, they can. But I want to make sure that the data on the timeline that was provided by West Coast University gave their August 20 numbers of 197, their August 21 numbers of 203, and that the tentative ruling when that was referenced by their legal counsel was March of 2021. And so that is the lower number of 197 if the board is thinking of considering that. Thank you.
Thank you, Lori.
If I could,
Mr. Casanova.
Can I clarify something, Madam President? Because it's incredibly important. There's 750 students enrolled in school that are going to start in January.
I know, but you had your opportunity to comment previously.
Dolores, we took our opportunity, and it would show in good faith that we are trying to build the bridge. So if legal counsel can address this one thing, that would be appreciated.
Go ahead.
I appreciate it. Thank you very much, Executive Officer. There are 750 students enrolled in the program and getting ready to start in January. So I'm not suggesting that any current students will be kicked out of class tomorrow, but those are 750 lives that will be impacted. And we all heard various times today from dozens and dozens of people, the wait list to get into nursing programs are 2 to 3 years. So while there won't be 750 students attending class today impacted, beginning in January, you got 750 students that are being told they can't go to nursing school.
Scott, can you clarify why you would tell those students they couldn't go to nursing school in January when you have a year to come in compliance with the enrollment numbers? Why would you change it for January?
How do you come into compliance within a year and then you have to teach them out?
You don't have to teach them out. No, I think you're missing the entire point, Scott. The entire purpose is to allow the program the ability to right size. It is not to address any of your currently students that are coming in January. You have 1 year to drop down to the number that is in front of you that is proposed by the board, which means you can maintain current operating procedures until November of 2024. And if you have an enrollment cycle that is starting in November of 2024, then at that point you enroll 170 students. We are not affecting anybody that's coming in January. Continue with what you're doing so that we can allow your school to be successful, so we can allow your faculty to be successful, so that we can allow the students that are currently in the pipeline and at West Coast University to continue. I think you're missing the entire point here, is our board is being incredibly lenient because we have heard you that this is going to cause an impact. Our board is desperately trying to give you guys an entire year to lessen that impact so that no students are affected. We understand that you have a 1 year students in your pipeline that we're not even aware of, and that they are slotted to start in January. And if you just took an enrollment in right now in November, they're slotted to start in November of next year. We want to make sure that those students that were accepted today into your general education courses have the ability to complete the education that they signed up for today, and that they are not negative affected. And then you will have the entirety of that program to teach those out. So if you have, in looking at all three campuses with the numbers that you've shared with us, you guys have 10,000 students enrolled in West Coast University's pre-licensure nursing program at any given time throughout the entire state. Those 10,000 students should progress and graduate in the next 3 years, the earliest student potentially starting yesterday. That student will be graduating in 2026 without any effect from this board's motion that is on the table today. Now, next year in November of 2024, if you drop the enrollments and come into compliance and you're at what the board has presented here at 170, instead of having 10,000 nursing students, you guys will have a different number. And that is 850, times 3. We're at 2,500 times 3 years. You guys would have about 8,000 students that would then continue to enter the workforce going forward until you come back with another enrollment increase request. This board has zero intention to affect any students currently enrolled at West Coast University that intend to go into the nursing program, into what you guys have defined as core nursing, which starts year 2, semester 1. We've taken that into consideration, and per my pleading early on, went from 6 months to 1 year to be able to accommodate that so that you guys can have the ability to take care of those students that are in general education courses right now and roll them into your core nursing.
If there's anything else on that, there's one other unrelated comment I wanted to circle back to.
Go ahead, Reza.
Oh, Okay. And, again, school, I think if they want to speak up, there's further confusion on what Lori just said. That's fine. That's an important issue to be straightened out. But I wonder if that changes how the school views what's currently on the table. But the issue I wanted to circle back to, importantly, not a huge thing, but what Lori was saying earlier about a school being able to come back and the question of appeal ability and all that. There is no appeal process, as Mr. Casanova identified, in regulation. If the board makes a decision, that's the decision, unless you were to go the alternative route of it being a proposed decision. It's what may have happened in the past. I wouldn't characterize it as an appeal or a request for reconsideration or anything like that. It just happens to be that if a school has an issue, they work through their NEC, and that's a pathway to potentially get in front of the board if that issue can't be resolved. So I think that's what happened in the past, but we're not talking about some kind of explicit appeal remedy that's not prescribed. So I hope that clears that up.
Yeah, thank you, Reza, for that. That was just showing that there was a previous school that had asked for requests for consideration, and they were brought forward. So I wanted to just be consistent with what has previously done in the past.
Any other questions or comments from the board?
I just Chair Trujillo, sorry, go ahead. I'll go after you, board member, Vice Chair Fagan.
Yeah, Nilo, I just really appreciate your comment about wanting to try to get objective information about clinical placement availability. I mean, in my opinion, that has been like the holy grail of being on this board, is really trying to understand the facts about what is available. And to the best of our knowledge, we do believe that they're clinically impacted in regions 7, 8, and 9, and we've made decisions denying enrollment growth or deferring people and asking them to go to another area because of this belief. Well, I wish that I could see a path to us getting much more objective data. Now, there may be some coming up. Lori, maybe you can reference this with the new legislation where hospitals are going to have to report their clinical placement availability. When will that go into effect?
To a 2-year bill.
Okay.
So it hasn't been passed yet. So it is still in the pipeline. We do still have a possibility of it going forward, but we haven't heard. But the last we heard is that it went to a 2-year bill. I do really quick want to interject. On our website, we do have the school pre-licensure data that is collected and updated on an annual basis that does report out school impaction and the various reasons that are reported out why they are displaced and impacted, and that is consistently done. It's on our website. It's collected through a contracted person with UCSF. They actually build the data bank and put those numbers in, so they cannot be altered by the board, and that is something that is public knowledge for many years.
Yeah. Although, even though I will say that includes, like, they were impacted because the Joint Commission came for an accreditation survey.
Correct.
Or they're remodeling a unit, not just overall capacity on an ongoing basis. So I think it still gets to exactly what we're hoping to get to in order to be able to make these decisions in a very objective way. So anyway,
Yes.
I appreciate what you're asking, but I don't think waiting till the next board meeting is going to get us there. And then the last question I need to understand is, what type of language do we need to include in the motion to be clear about the requirements that are going to be different for that we want to be different for the LA campus because of their less than 75% performance on the NCLEX? I'm not sure how we need to word that.
Go ahead, Lori.
I think the easiest way is that we're re-existent campus to campus because it is a programming. It is an entire program. And so when you do the motion that is to go from the current approved enrollment of 100 students 5 times a year to 750 students 5 times a year at each one of the campuses, that the only caveat is after if they have the 1 year to come into compliance with that if the LA campus is still below 75%, that campus wait to implement that approved increased enrollment number until their pass rates are above the 75% annual. And again, as what was shared with us with Q1 data by Key Arena, that actually may not even be an issue at that point, because the full expectation is that as of the end of June next year, and we get the numbers in July, that they'll be above 75%. And then all campuses will be aligned and the program will go forward as a whole.
This is Reza. On the screen, there's a quote, possible motion. I'm assuming that was, drafted as, well before we ever started talking this. Just an option to put out there, if it would help to take maybe 5-10 minutes. I think we have heard the board and kind of what the motion is intended to be, and we could kind of script that. And if it appears to be what you actually intend when we come back, then that might help everybody to understand what's actually on the table.
Mary, were you saying something? You were on mute.
I thought I had, I thought I had written down what needs to happen, but Reza, I really would appreciate if we get it there, we can all look at it and read it at the same time and make sure that's exactly the motion that we want and what we want to vote on.
Okay. Do you think 5 minutes or 10 minutes, Reza, to get a motion on?
I would say 10.
10 minutes? Okay.
10 just to be safe.
Well, 10:20, we'll come back.
Sorry.
Yes, go ahead, Allison.
This is Board Member Cormack. Chair Trujillo, may I make a few comments before we move to that? I was pleased to hear the applicant describe an interest in resetting the relationship. I think anyone who watched yesterday can imagine that needs to happen. There were a lot of emotions. And those are understandable, right? It's understandable. People feel strongly about this profession. We've all been touched by it personally, and we are not done with the effects of COVID. And I want to acknowledge that. I also just want to be sure that I understand correctly that in the event this is approved today, the applicant could return tomorrow with an application for the number they were using was 203 in a cohort. Is that right? If we approve this today, they could return tomorrow and use updated information, et cetera.
They would not return to the board tomorrow. They would go to the NEC, and then they would send the request. That NEC would review the request, make sure everything is put together, and then they would, and once that is finalized, it would go on the next ELC meeting after that review is complete, and then ultimately to the board to follow.
But they could tomorrow start a process with new data off of what is essentially the reset number. Okay.
Yes.
And finally,
Cormack,
I'm sorry, I'm still speaking. Mr. Casanova, thank you so much. I'm still speaking. I was disturbed to hear an allegation by the applicant that somehow the vote had already been decided. I'm not sure who that was directed at. I can say that, I have never met in person the maker of the motion. The first time I saw her was yesterday online. I do not have contact for information for her. I had never spoken with her except in a public forum starting yesterday. So I just wanted on the public record that there is nothing about my second of the motion that was premeditated. And I used data yesterday to identify an inflection point. To me, this is the process working as intended. If another board member heard that with and incorporated that, I don't see that warrants the allegation that was made. And I would like to just make sure that that's on the record.
Thank you, Allison.
Board member, I just wanted to suggest I don't know that anything would change in submitting a new application with the number of 204, but there's no reason a motion can't be made today to accept an enrollment number at that level, at what it was, or Executive Officer Melby suggested it was 197 in 2021. There's nothing that would obviate the board from doing that today. And frankly, that's an off-ramp that we can accept and all move on from. But a 30% rollback of enrollments, that's going to have a draconian impact on staff and faculty that's not tied to an objective basis, that's something that the university simply can't accept. So there is an off-ramp today that we can put this behind us, approving those 2021 enrollments.
Ask a quick question. This is Reza. The school has kind of disputed at what point it became clear that the board had oversight of enrollment, and whether it was 2013 or 2015, 16, 2018, 21. The motion on the table was kind of based on 2018. Mr. Casanova identified 2021. Has the school grown in enrollment since 2021 without going through board process for enrollment increase, since according to your own statement, that's when it was crystal clear? I'm not acknowledging that it was unclear prior to that. Let me be clear. But my question, pretty simple, yes or no. Has the school grown since 2021?
Well, yeah, you have that data. Obviously, we submitted the timeline that you have before you.
Okay. So it was pretty clear and very good. Any other questions, comments?
Comments, yeah.
Otherwise, I think the idea was to take a quick break, get what seems to be the proposed motion in writing, and then go from there.
10 minutes. Is that long enough?
Okay.
Even 12:30, then I suggest that we come back, clarify the motion, go to vote, and then take a lunch.
Perfect. Thank you. We'll come back at 12:30. Okay. Welcome back. Again, a quick roll call to make sure we still have a quorum. Dolores Trujillo's present. Vice President Mary Fagan.
Mary Fagan present.
Jovita Dominguez.
Jovita Dominguez present.
Shawan. David Lawler.
David present.
Vicki Granowitz.
Granowitz present.
Allison Cormack. Neelu Patel.
Patel present.
Thank you. So it looks like we have a motion.
I think there was going to be a draft of a motion for us to.
Is this the draft?
Yeah.
Okay.
Chair Trujillo, this is Board Member Cormack. While they're pulling that up, before we vote on it, I'd like the opportunity to discuss with the maker of the motion possible amendment before we vote once we see it.
Sure. Is Reza here?
I don't know. You might want to ask for him and Lori to see if they're.
Reza.
Hi, Reza.
Sorry. I think we're just working on getting that language over and up on the screen. So if you just bear with us, I don't think it should be more than a few more minutes.
Thank you, Reza.
May I?
Thanks. Sorry about
that. Chair Trujillo, then share my thoughts from
Sure.
over. Thank you so much. So really our job here is to protect and maintain the public interest. And I think it's in the public interest to end this longstanding dispute, if that's within our power. We certainly heard from suggestions from the applicant that, numbers of a cohort closer to 200 than 170 would be acceptable to them. And we certainly heard the likelihood of a lawsuit if they did not receive that number. We also heard from two of our board members who are uncomfortable about us making a decision today they would have such significant impacts. So if I reflect on the objective we have here today and what I'm sure everyone would rather be spending their time on, which is educating nurses to get out there and help people who are not feeling well. I'm thinking that it might be in the public's best interest if Vice Chair Fagan agrees to adjust the 170 number when it comes up to a number that we will unfortunately have to fight over a bit, because I heard a 197 number and I heard a 192 number and I see a 203 number. And those are the cohort numbers for academic years 2020 and 2021.
Yes, Allison, I misspoke and said it was 197. It was 192 for the time that motion was put forward by the court.
192 during the academic year 2020?
It's on the timeline in the materials that are presented on the board. It starts at page 175. And it says that in August 2019, it says starts average 170 students entering the core nursing. And then August 2020 says starts average 192 students entering the core program 5 times a year. And the tentative ruling was passed down on March 12th, 2021. The next number is an increase that is given to us in August 2021 that claims that they had 203 starts. So to be in alignment with what was requested by council, it would be 192 students entering the core program 5 times a year, consistent with what was brought forth in the court proceedings.
Okay. So, all right. So the 203 number that the applicant referenced earlier, we are now all in agreement is a 192 number.
That is what is consistent with the timeline that is in front of us, provided to us by West Coast University, knowing that the tentative ruling was passed on March 12th, 2021.
Great. So the other thing I'm doing, looking at my handy dandy spreadsheet, is recognizing that really the biggest, the difference between the West Coast University NCLEX pass rate and the California one was still, it was 1.1 percentage points in 2020. And that it increased, it doubled after that, and then it more than doubled again. So while we had originally talked about the academic year 2019, and we look at the, a cohort enrollment of 170 that matches to that, I'm comfortable from a public interest standpoint that the 2020 number, which is a cohort enrollment of 192, still demonstrates that the school was able to successfully appropriately educate the nurses there. So with that long preamble, it does help sometimes to just walk outside and just take a moment to think about what is the objective here. If the maker is willing to amend the motion, which I see we now have, then the number, I guess they've pulled it all out here. So each of the 170 numbers would become 192. And then each of the 850 numbers, I will have to do math. or someone can do it for me. And then the 2550 number would also change. So
the 850 numbers would be changed to 960.
Okay.
The 510 number would actually be changed to 576.
Okay.
And the overall program number would be changed to 2,880 students.
2,880. So 170 becomes 192, 850 becomes 960, 510 becomes 576, and 2550 becomes 2880. So that is my evolved thinking here, and just wanted to share that with the maker of the motion to see what your thoughts are at this point in the proceedings.
Allison, I really, really appreciate that because I definitely could sense that we can get agreement with the program and hopefully move away from this contentious issue that's been taking so much of our time. So, and I do recognize that there NCLEX performance rate during that time was still very high at 87.1. So it wasn't until after that time that they really started to decline more. So I would like to amend my motion to approve the substantive changes requested by an approved program for an enrollment increase for West Coast University Baccalaureate Degree Nursing Program. The Orange County campus to enroll 192 students 5 times a year for an annual enrollment of 960 students. The Ontario campus to enroll 192 students 5 times a year for an annual enrollment of 960 students. And the LA campus to enroll 192 students 5 times a year for an annual enrollment of 960 students. The total program enrollment is 576 students 5 times a year for an annual program enrollment of 2,880 students. So also include that the Los Angeles campus will delay the implementation of this approved enrollment increase until its annual NCLEX pass rate is above 75%.
And that you have 1 year to come into compliance.
Oh, right, exactly. And with 1 year to come into compliance. Yeah, thank you.
President Trujillo, do you have a second?
I would.
To continue my second for the motion as amended, and I appreciate the makers' work on this.
And President Trujillo, I have a comment.
Sure, go ahead, Tricia.
You know, I am unhappy with this school. I'm unhappy the way they do business in this state. I think it's just a pattern of real disrespect to other schools and to this board. But I completely embrace Allison's thoughts about our state is well served if we can come to terms with this school going forward. And so I will be supporting this motion.
All right. So we have a new motion on the floor with
This is Reza.
Go ahead, Reza.
Sorry. What's on the screen has been updated. I noticed with the new numbers that were motioned and seconded. Am I missing the 1 year piece on there? Is it possible, just for the sake of the record being accurate and the video later and all that, that we have that added? I know that's part of the motion, right, Mary and Allison?
Yes.
1 year.
1 year to come into compliance.
Board moderator, are you able to amend the slide to add 1 year to come into compliance, please?
For the LA campus.
No, for all. All campuses have 1 year to come into compliance.
The compliance is to get in compliance with the enrollment numbers. Their LA campus getting in, to that 75% level, that's as long as that takes.
They've updated the slide. Does that accurately reflect what you were thinking, Reza?
Well, it's not exactly my motion, but
no, but what you were
appears
thinking
to be what they were.
Yeah, to update the West Coast, will have 1 year to come in compliance. You would mention that needed to be added to the slide. My ask was what was added to the slide by our board moderator. Does that accurately reflect the request that you had to add the motion to the slide on the website?
It does. It's fine. It's fine. Cool. I think everyone understands, as far as what I was just clarifying, that's to get in compliance with the enrollment numbers, NCLEX piece.
Perhaps this is Board Member Cormack. We could just have the board moderator remove that last sentence after the second to last sentence, after the 2880 students period. And then it's clear that the compliance is attached, the 1 year compliance is attached to the overall numbers, and there won't be any confusion at all. If that's
I would like to suggest, if you don't mind, that we add a November 2024 date to that, so there's no confusion about when that 1 year will be.
Helpful.
Of course, if it's okay with with Mary and Allison.
That looks perfect to me.
Appreciate that.
Reza, this is Jovita. Will that also comply with all campuses if they write that as a sentence?
Yes, it goes over the, it says total program enrollment. And so it is tied to that one.
Yeah, it's referring to WCU that has the 1 year to
Yeah.
come into compliance. So across their 3 campuses.
So I will go ahead and restate the motion for clarity. Motion to approve the substantive changes requested by an approved program for an enrollment increase for West Coast University Baccalaureate Degree Nursing Program. The Orange County campus is approved to enroll 192 students 5 times a year for an annual enrollment number of 960 students. The Ontario campus is approved to enroll 192 students 5 times a year for an annual enrollment number of 960 students. And the LA campus has been approved to enroll 192 students 5 times a year for an annual enrollment number of 960 students. The total program enrollment is now 576 students 5 times a year for an annual program enrollment of 2,880 students. West Coast University will have 1 year to come into compliance. That is November of 2024. The Los Angeles campus will delay the implementation of this approved enrollment increase until its annual NCLEX pass rate is above 75%.
Sorry, I did have one additional question. I'm just trying to iron out the details so that we're not discovering them later. The LA campus, assuming that the motion passes, between that time and the time that their NCLEX pass rate hits that threshold, what is their number?
Number that they are approved for currently right now is 100 students 5 times a year. That is what each campus is approved as. That was the last board motion that was put on the records in 2013. Further clarification is that we did give them a year to come into compliance. So no numbers need to be adjusted at that campus until that year is up, consistent with the other campuses. And if in July that annual pass rate is above 75, as they are predicting, LA campus will not have any adjustments and they will just fall in line with the rest of the program. If November 2024 comes and their annual pass rate is less than 75, the expectation for them to come into compliance would be that the LA campus be at 100 students 5 times a year, because that is what the current approved enrollment numbers are for each one of the campuses.
Here, thank you for that. That helps me to understand. The LA campus has until November 2024 to bring it down to the 100 5 times a year, unless they've brought their test rate up to that 75% threshold, in which case they will be approved for this increase to 192.
Correct. And then at any point, if they go into July of 2025 and their annual pass rates are at 75%, they would then be able to adopt the 192. But it is an annual pass rate, not a quarterly pass rate that the board considers.
Thank you. Are there any questions from anyone either side as to what the motion is? Okay, I think.
Okay, so maybe we should state the motion. Mary, state the motion. We have a second from Allison. Do you want to restate it or go to public comment?
I think Lori just restated it. But
I had restated it.
Yeah.
It's fine. We can go to public comment.
Great. All right, BRN moderator, can you please open it up for public comment?
To comment now, please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment," and please remember to only submit 1 time. Thank you. Board President Trujillo, there are no public requests for comments. Would you like me to close this window?
Yes, thank you. All right, we'll take it to a vote. Dolores Trujillo respectfully votes no. Vice President Mary Fagan.
Mary Fagan, yes.
Jovita Dominguez.
Votes no.
Patricia Nguyen.
Win, yes.
David Lawler.
David, no.
Vicki Granowitz.
Granowitz, yes.
Allison Cormack. Neelu Patel.
Patel, yes.
Okay, motion carries. Thank you. That was a very difficult piece, and I understand it was a long time that we talked about this. So I appreciate everybody's input, including West Coast Universities and public comments. So at this time, before we move on in the agenda, Lori, you had talked about going to lunch.
Would really appreciate that.
Why don't we go to lunch?
Are we going to come back in closed session, or do we come back?
We have
There's
two
still
information.
agenda. Okay.
Yeah. We have essentially we have two information only items coming up that can be wrapped up quickly. We do have enforcement, and then ledge can be information only. So we could wrap this up very quickly after lunch and go into closed session.
Sure.
Thank you.
45?
Let's do 40. It's 12:50 right now, and that would let us come back at 1:30.
All right, great. See everybody back at 1:30. Thank you. There you are. Okay. Let's do a quick roll call to establish quorum. Dolores Trujillo is present. Vice President Mary Fagan.
Present.
Board Member Jovita Dominguez.
Jovita present.
Thank you. Board Member Tricia Nguyen. Board Member David Lawler.
David Lawler, present.
Board Member Vicki Granowitz.
Granowitz, present.
Board Member Allison Cormack. And Board Member Neelu Patel.
Patel, present.
All right, we've established a quorum. Moving on to item 8.8. This is information only. NCLEX update. Lori, do you want to do both of these together?
And they'll be very quick.
All right.
8.8 is the NCLEX update. 8.9 is the licensing update. These are not things that have not been discussed in the previous today or yesterday. Those are all items that have been discussed. If the board has any questions, I'm available for questions.
Any questions or comments from the board? Okay.
No question, no motion needed. We can go to public comment. Thank you.
BRN moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. Sorry, I'm doing double duty again.
It's okay.
Where'd it go? Did it come up? Nope. You're coming up. Why are you guys coming up? Uh-oh. Well.
I don't like the sound of that. Uh-oh.
Word moderator, you're killing me right now.
I
Why
know.
are we saying uh-oh? What's up?
Because I can't get the, I'm just going to go back to the slide. Little slide. Let me go there. Okay, I'll just go back to the slide. We'll just go back to the slide. Here we go. Okay, I have activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments. Would you like me to close this window?
Yes, thank you. Okay, 8.9. I believe, Laura, you gave the report on that also. We're going to open back up to public comment, or was that public comment for both items?
It was public comment for both items, so we can move on to 9 point.
All right, 9.0. This is the report of the Enforcement Intervention Committee.
Thank you all very much. I know that Tim Buncher will be presenting this item 9.1. Thank you, Tim.
Is Tim elevated? Oh.
Good to see you all again. Information update for enforcement, providing this in Shannon's absence as she's in our IEC meeting today. No major updates, but I did want to call your attention to one data error that we discovered yesterday in reviewing. On page 9 of your packets, for the total case processing time, average days to complete, the current value there is 287 days. That's incorrect, and the correct number is 657,657. So just wanted to orally correct that here. Do you have any questions regarding our report or questions that I can answer?
Tim, this is Tricia. I just wonder if there's anything in this report that stands out to you as kind of very different than you're used to, or any surprises in this report?
Not any surprises. The thing that I'm, I'll say individually very happy for is that we filled our vacant discipline manager position. That was a very long recruitment process from back when I promoted a little over a year and a half ago. So having our new manager, Angela May, start with us has been absolutely fantastic, and definitely made kind of actually officially now our enforcement unit is fully staffed on the manager deck since approximately July of 2020. So it's been a long time coming, but we finally hit kind of the fully staffed part on the management side.
That's great. Thank you.
Of course.
Kim, I'm just curious, I'm new to the board, so if you could just touch on why you think that error may have occurred. That's basically like close to about 400 days that's been off in terms of initial.
Correct. Yeah, we think we figured it out is that the 287 is the volume of cases in that time frame, and then the 657 is the actual aging value. So it's just a transpose of taking the count versus the actual aging.
Any other questions or comments from the board?
Well, again, Tim, just one more question. Is that number, that 500, did you say 587?
657.
Sorry, 657. Is that number kind of historically on the high end or historically on the low end, or is that about what it's been for a while?
I would say it's pretty much average. Obviously, across all of DCA, the goal is 540, but we're honestly happy if we can stick around 600 to 650. Obviously, 657 is a little bit over, but looking at kind of the volume of our cases that are resolved under the 540, which is 45%, is a pretty good number for us.
Thank you.
Tim, this is Mary Piggin. I know we talked previously, and I thought I saw some reports where this data was presented sort of in a tabular format where we saw what is the goal, where are we, and how are we progressing, either with a chart or some way that we can really look at performance over time. Haven't we done that in the past? I haven't seen it recently.
I'd have to double check, but I believe we do that in the annual update after the fiscal year numbers are done, which is, I believe, usually the August or September board meeting, depending on how the schedule falls. I know historically we used to provide that data separately, but did slim it down probably within the last year, I want to say, but don't quote me on that. I can confirm if necessary. But if that's something you guys would be interested in, we're more than happy to pull the data for it.
Yeah, I think, especially when I was it's challenging for me looking at this to see how we're performing. I know compared to the goal of 540, but when you look at all the other boards, they're well over 540 as well. So I'm not sure how relevant that goal is, but to be able to just look at this quickly and say, how are we performing, over time? And then what are the things that are we able to do to improve performance where we have that opportunity?
Okay, I've made a note so that we can include that for next committee and board.
Thank you.
Any other further questions or comments from the board? All right. Tricia, was there?
That was just an information only. So maybe we could move to 9.2. And Tim, this is something that Shannon normally does. Are you prepared to take up this item?
Of course.
Thank you.
No worries. So item 9.2 is we're requesting the board's motion for vote to appoint a handful of new appointments to our nurse intervention evaluation committee. And I'll briefly read through those names, and I apologize in advance to any of these individuals if I mispronounce it. No ill intent is meant. The first individual we have is Glenda Lando, who is an RN member in IEC 1 with a new appointment with a term expiration of June 30, 2025. The next is David Granovetter, MD, physician member, IEC 1, a new appointment, term expiration of June 30, 2025. Natalie Renfield, Psych D, public member, IEC 4, a new appointment and term expiration June 30, 2025. Richard Avila, nurse member, IEC 4, new appointment, June and term expiration of June 30th, 2024. Jason Barrett, physician member, IEC 5, new appointment, June 30, 2025 expiration date. Salma Khan, physician member, IEC 11, new appointment, expiration June 30, 2024. Michelle Corcoran, nurse member, IEC 11, new appointment, term expiration September 30th, 2027. And lastly, Jonathan Terry, physician member, IEC 12, new appointment and expiration June 30, 2024.
Thank you, Tim, and good job on your recruitment. I understand now that all the IECs are full. So congratulations on that.
Thank you.
Are there comments or questions from board members? Hearing none, I'd like to move that we accept the appointment of the Intervention Evaluation Committee members as described above.
I'll second it.
Great. We have a motion and a second. Any discussion? Maybe we can go out to public comment. Thank you, board moderator.
Who's second?
Dolores seconded. David came in a short third. And then for public comment, it'll be on items 9.1 and 9.2 as we missed public comment on the information only for 9.1.
Lori?
You're welcome.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give reminders as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Nguyen, there are no public requests or comments. Would you like me to close this window? Or is that board member Nguyen? I'm sorry. And you're muted.
Tricia, I think you're still muted.
Very much. Madam President, I was wondering if you would go ahead and take roll, please.
Sure. Okay, so we have a motion and a second on the floor. We'll go ahead and take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan?
Mary Fagan, yes.
Board Member Jovita Dominguez?
Yes.
Board Member Patricia Nguyen?
Nguyen, yes.
Board Member David Lawler?
David Lawler, yes.
Board Member Vicky Granowitz?
Granowitz, yes.
Board Member Allison Cormack? And Board Member Neelu Patel?
Patel, yes.
Thank you. All right, let's move on in the agenda to item 10.0. This is the report of the Legislative Committee. This is my committee. Is Marissa present? Okay, great. Thank you.
Mm-hmm. She is in the attendees, so just take a second.
No problem.
Good afternoon, everyone.
Good afternoon, Marissa.
So as Lori indicated, this is just an information only agenda item, so no more hard votes to take. I just wanted to give kind of a overview of this past session very briefly, and then we can jump into any specific bills the members may like. So October wrapped up the first year of the 2023-2024 legislative session. Over the course of this past year, the board took a position on 30 individual bills. 16 of those bills made it to the governor's desk, where 14 were signed into law, and then 2 were ultimately vetoed. The remaining 14 bills were held at some point in the process, either in a committee or on the floor, making them 2-year bills. So those bills can still be acted on next session. Only minor caveat is that any bills that were held while still in their house of origin will need to be passed out of that house of origin by January 31st, 2024. So with the legislature going back into session January 3rd, obviously that is a bit more of an expedited time frame. However, if they made it to the second house, then they kind of follow the same natural calendar that other newly introduced bills would next year. Information on all 30 of those bills is contained in the meeting materials, along with the board's last position on record. So happy to discuss any specific bills or answer any general questions.
Thank you, Marissa. Any questions or comments from the board members?
Mac, I see that there are 2 bills remaining that are in 2-year status that the board has taken an opposed position on. That's AB 1028 and AB 1292. Can you just briefly go over the reasons for the opposition? That'd be helpful.
Sure. So AB 1292, and I can actually pull up the letter just so I'm making sure I'm getting it appropriately. Quoted.
Author Flora, and the title is Nursing Distance Education Nurse and Program Students.
Yes. So that bill would have allowed students who were enrolled in pre-licensure distant education nursing programs that are based out of state at private post-secondary educational institutions to complete their clinical hour requirements in California. So currently under the Nursing Practice Act, in order to provide nursing services, you have to be in a California approved program. So this would have amended that to allow students who were enrolled in schools based outside of California, but maybe physically located, however, they weren't California approved programs, to do their clinicals in California. And
I understand.
Okay.
I understand. That makes sense. And then AB 1028?
And then AB 1028 had to do with mandated reporting. And let me make sure I'm just quoting it correctly. So currently a healthcare practitioner, which would include nurses, have to make a report to law enforcement when they suspect a patient has suffered physical injury inflicted by a person's own act or inflicted by another, where the injury is means of firearm caused by assaultive or abusive conduct, including elder abuse, sexual assault, and torture. So this bill would have removed the requirement for a healthcare practitioner to make a report to law enforcement when they suspected the patient had suffered physical injury caused by assaultive or abusive conduct, and instead only required that report if the healthcare practitioner suspected a patient had suffered a wound or physical injury reflected by the person or inflicted by another, where the injury is by means of firearm, wound, or physical injury. So essentially it had to do mainly around suspected domestic abuse situations in which currently it is required that nurses are mandated reporters. This proposed law would have changed that and instead not mandated that the nurse or healthcare practitioner make that report to law enforcement. It would have been at the discretion of the patient. However, it would have required some type of connection to services or referral to other kind of supportive services in the area.
Thank you. That's very clear. Appreciate it. No more questions or comments.
All right. Thank you, Allison. Any other questions or comments from board members? Seeing that there's not any more questions or comments, BRN moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Christine Christoph would like to make a comment. 1 second, please.
Is she not able to? Did you unmute her?
I sent her a request.
Okay.
Christina, you're not able to unmute. There should be a pop-up in the middle of your screen that says unmute me. I guess if you can't unmute, should we have her type it in the Q&A box?
Sure.
Go ahead and type your question in the Q&A box. Her question was regarding the last motion.
The motion just now that we're opening for public comment? I can't see what she's writing on my end.
Agenda item 9.2.
If it's about the motion on agenda item 9.
Enforcement. It was probably the members. It's the only motion that we voted on is to accept the members.
Yeah, since we came back from break, I think that's correct, Dolores. The only motion was on 9.2, which was the appointment of IEC members, and that vote was to approve these nominations of the individuals listed in the agenda to the intervention evaluation committees.
That it's regarding enforcement, and we did open up for 9.1 as well on the information only. It wasn't on a motion, but if she
I'm not seeing what she's chatting, but what is she looking to make a comment about a particular item, or just looking to hear what the motion was?
She just said it's okay to move on. Christine,
Okay.
if you want to get my contact information off the web and send an email, I'll work with getting whatever question you have answered.
Okay.
Keita would like to ask a question. 1 second, please.
She wrote her question.
Yes, and she's being sent in unmute too. She's on a cell phone, it looks like. So hers would be *7 or #7, whatever it is. And hers is a general question.
Lori, can you see? Can you answer this for her?
I'm not able to see what that question is. Here we go. It's again regarding enforcement. It says that she applied to be a content specialist, not received response. Keita, if you can go ahead and reach out to me on the via email. My email address is on our website, and I will forward it on to enforcement so that you can get an answer.
Okay.
Board President Trujillo, there are no other public requests for comments. Would you like me to close this window?
Yes, please.
Sorry, Mark, real quick before you.
Oh, sorry.
I had a comment in there about how often the BRN can. There was something about how often can you be on the BRN or something. I don't know if I was reading it correctly. It was
How
maybe
often
phrased a
do
little
you
funny.
have an opportunity to be on the BRN board?
Okay. Yeah, that's what it was. It's not really on the agenda, but real quick, you have all our board members are appointed by the governor or appointing powers within the Assembly and Senate, and they get up to 2 terms.
Okay. Since this was a report, information only, we can move on in the agenda. That brings us to 11.0, closed session.
Head and adjourn the open session. We will then no longer have any further webcast. And we will open in closed session. Board members, a Teams link has been sent to your email, and we will join on that one. Resident, will you be coming back into WebEx to adjourn?
Yes, that's what I was going to. Okay, so the webcast itself is going to close, but the WebEx will be held open. However, there's no more open session business to discuss when we come back. It's just for the formality of adjourning the meeting. But yes, we should do that.
If board members Do you want the board members to keep their WebEx up, but just close out of the and stop the video, or?
It is typically easier to keep everybody up because there typically is some kind of issue with trying to get them to rejoin.
Exactly.
However, it is imperative that everybody's camera is off and all mics are muted, and board moderator would be monitoring that to make sure that it stays that way.
Thanks, Lori. Okay, we'll see everybody in closed session. Your links to Teams will be in your email. Let us know if there's an issue logging on.